एनीवे मैं स्टार्ट करूं? मैं स्टार्ट करूं? Hi everyone, is it audible? बोलो एक बार. See if I am audible and visible. Please let me know. Okay, fine. ठीक है, चलो. See. Yes, all right. So okay, so I have restarted and I'm doing from Zoom now. So I think now this should be okay, right? This should be okay now. So okay, so basically I was explaining about what? Yes, fat embolism, right? Fat embolism, है ना? Fat embolism. So remember here, whenever there will be fracture in long bones of adults, long bone fracture, remember here, long bone fracture, this is always the surgery of emergency, because fat embolism can occur. Fat embolism can occur after 48 hours. Fat embolism can occur after 48 hours, where there'll be what? Respiratory difficulty and all. Remember here, see, whenever you see respiratory symptoms like shortness of breath, mental confusion, and rashes over the body, yes, you can understand these. Okay, this is a case of what? Fat embolism. This is a case of what? Fat embolism, right? No, but in the same, see, at the same time, if I ask you, what about, suppose if the long bone fracture in the age, long bone fracture, suppose if there is a 9-year-old boy. Now, so do you think this is a surgery of emergency? No, so no problem at all, because in the 9-year-old boy, long bones, yes, there can be what? Basically, there will be what? So red cells only, you know. So even after a few days also, you can operate. But if it is in the adult, operate as soon as possible, because there is high risk of fat embolism. There is high risk of fat embolism. So I hope all these points are clear to all of you. Some more clinical relations we can have here. Some more clinical relation. Remember, so when I told you that in adults, now see, in the adults, long bone, in the long bone, there will be fat cells. So if you have to do bone marrow aspiration, or kind of bone marrow aspiration for bone marrow biopsy, for any case, for any kind of the blood cancer, what is the best bone to choose? In adults, best bone for bone marrow aspiration is what? Ischium bone. After that, sternum. After that, sternum. Ischial bone first, after that, sternum. In this same manner, if I ask you, what about the young age group before puberty, what is the best bone for bone marrow aspiration? Then you can choose long bones like tibial bone, I hope all these points are clear to all of you. Next question. See this question now. This is related to neurophysiology, neuroanatomy. A patient has good language comprehension, but his speech production is impaired. His speech is slow, slurred, and non-fluent, right? Which part of brain is affected? which part of brain is affected? Remember here, basically I'm talking about motor aphasia here, no? Right, no? See, remember here. So, what is the answer? See, remember, ideas will be formulated, ideas will be completed in what? Wernicke's part. This is Wernicke, no? Wernicke's part. But speech, the motor part, which you are going to speak out, that will be in the Broca's area, right? No? So there will be the damage in Broca's area, right? No? Broca's area. Remember, Broca's area and Wernicke's area, Brodmann area, if you remember, very, very important. Fine, no? Slow speech, fine, no? That will be in the Broca's. But when I talk about Wernicke's aphasia, no? There will be what? Word salad. Word salad, very, very fast, right? No? My question is that which area signifies Brodmann's area and which area signifies Wernicke's? Can you answer me? Yes, if you remember, please answer me. Yes, very good. 44, 45, this is what? Broca's area. And area number 22 is what? Wernicke's area, right? Wernicke's area. So there will be what? Word salad. Next question. This is also a question of, if you see this question, what is the diagnosis here? First of all, what is the diagnosis? Can you answer me? What is the diagnosis? Yes. See, even with the help of this radiological appearance, you can easily understand that, yes, there is what? Bird beak. There is what? Bird beak appearance. Bird beak appearance. Where do you see bird beak appearance? As per the clinical scenario, you can see dysphagia for water more than food. Okay, so liquid more than solid. This is a case of what? Motility disorder, where you have seen this kind of condition on the barium swallow, 𝗙𝗵𝗂𝗃𝗃. Right? 𝗙𝗵𝗃𝗃. So there will be, so what is the pathophysiology of 𝗙𝗵𝗃𝗃? This is a question related to general part of surgery. But yes, examiner is asking question related to pathophysiology, right? So if I ask you across GIT, how many nerve plexuses are there? 2 nerve plexuses are there. Which 2 nerve plexuses? Can you answer me? One is �Yourбек plexus. Another is Meissner's plexus, right? Meissner's plexus. When I talk about �Yourбек plexus, this is also called as myenteric plexus. This is also called as myenteric plexus. Remember, across GIT, there are 2 nerve plexuses. One is �Yourбек, another is Meissner's. What is the function of �Yourбek plexus? Can you answer me? What is the function of �Yourбek plexus? It is what? Peristaltic movement. Peristaltic movement. What about Meissner's plexus? Secretion, right? Secretion. Remember one important point. In esophagus, only 1 nerve plexus is there. Only �Yourбek plexus is there. Remember here, in esophagus, Meissner's plexus is absent. That's why in esophagus, secretion is also absent. Fine. �Yourбek plexus, which is responsible for peristaltic movement, right? A peristaltic movement here. So yes, in 𝗙𝗵𝗃𝗃, there is degeneration of �Yourбek plexus. Degeneration of �Yourбek plexus. I hope all these points are clear to all of you. At the same time, if I ask you one question, can you answer me? What is the name of surgical procedure for 𝗙𝗵𝗃𝗃? What is the name of surgery? Bolo answer. Dolman procedure or something else? For 𝗙𝗵𝗃𝗃. Yes, 𝗙𝗵𝗃𝗃 is what? Heller's cardiomyotomy. Heller's cardiomyotomy. Remember here, Heller's cardiomyotomy is used for 𝗙𝗵𝗃𝗃. So, what is the complete management of 𝗙𝗵𝗃𝗃? Heller's cardiomyotomy with partial fundoplication. Heller's cardiomyotomy with partial fundoplication. This is the surgical procedure for 𝗙𝗵𝗃𝗃. If I ask you these days, what is the most important non-invasive procedure or very less invasive procedure? New technique, something which is called a POEM, per oral endoscopic myotomy, right? Now, per oral endoscopic myotomy, right? All these questions are important related to 𝗙𝗪𝗂𝗃𝗃. Remember, this radiological image is very, very important, repeatedly asked question in MCI exam. Bird beak appearance, right? Okay, fine. Bird beak appearance. Where do you see corkscrew esophagus? Corkscrew esophagus, where? Where do you see? Where? Yes, in diffuse esophageal spasm. Diffuse esophageal spasm. When I say the Dolman's procedure, what was your answer? Dolman's procedure for Zenker's diverticulum. I am expecting that you people are already completed 19 subjects minimum for 2 times, right now. So I can ask you so many questions and you should be able to recall, you should be able to answer these questions because these are repeatedly asked questions. Okay, chalo, next question. After an RTA, a person suffered severe head injury. All of the hormones will be affected except, this is a case of what? This is a case of physiology. Physiology. Can you answer me? Option number C, like examiner could have given you option number like C, like instead of somatostatin, examiner can give you option of insulin also. Insulin also. Now you can easily answer. Head injury hua hai na, so the glands in the head will be affected first. In the head, yes, there is what? Pituitary gland, hai na? Pituitary gland. Anterior portion, anterior part and posterior part. Yes, these are going to secrete what? Prolactin, vasopressin, ADH, right? FSLH, right now? ACTCH, right now? So these are secreted by pituitary gland. But what about option number C? Secreted by pancreas. Pancreas, alpha cells will secrete glucagon, right? Beta cells secrete insulin. And delta cells secrete what? Somatostatin. Somatostatin. I hope all these points are clear. So will be affected except pancreatic, no? Pancreatic hormones here, no? Secreted by the pancreas here, right? Very easy to understand. These chemicals you can easily rule out. Old question. Next. Yes, after recovery from a head injury, a man wants to reach for a glass of water, but his hand either stops in the midway or overshoots. On examination, he is not able to perform the examination as shown in photo. Which test is shown first of all? Yes, this is called about finger nose test. Finger nose test. Remember, so what is the answer here? What is the function of cerebral cortex first of all? Can you answer me? Cerebrum function, cerebrum. Yes, memory, speech, and all. Remember here, whenever there will be lesion in cerebral cortex, there can be what? Amnesia, loss of memory, aphasia, loss of speech, apraxia, loss of action, agnosia, inability to recognize a stimulus. Okay, this can cause prosopagnosia. When a person is not able to recognize a known person, that is called a what? Prosopagnosia. Prosopagnosia, right? In the same manner, if a person cannot recognize himself, it is called as what? Autoprosopagnosia. So when these are going to be there, you can say that, okay, cerebellum problem. I'm sorry. Okay, when these problem will be there, when there will be what? You can say what? Damage in cerebral cortex. Cerebrum, cerebral cortex. Right now, cortex. But what is the function of cerebellum? What is the function of cerebellum? Cerebellum, a small one is a cerebellum. Okay, no? Fine. So what is the function of cerebellum? Coordination and balancing. You ask a person to jump and land smoothly. This is because of what? Cerebellum. Okay, if there will be damage in cerebellum, if you ask a person to hold a glass, so either he's going to stop here or overshoot, right? You ask him to do like this, finger nose test. He will not be able to do like this. See, suppose if you ask him to do alternative movements like this, he will not be able to perform, right now. Fine. So it means what? There is a damage in cerebellum. Cerebellum. If you ask him to walk and to take sudden turn, he's not able to do this. Cerebellum problem. Heel and sheen test, right? All these we have learned in physiology part of Cerebellum. Cerebellum. Answer is C. Answer is C. Next question. A father is standing near a doctor who is doing dressing for a cut injury to his 5-year-old son. While watching the wound, father fell down. Most of you would have marked carotid sinus syncope. Okay, yes, I can understand that this is a case of syncope, right? This is a case of syncope, and most of you would have marked option A, but that is wrong answer. Wrong answer. Syncope, how many types of syncope? There are 3 types of syncope. Carotid sinus syncope means what? When there will be neck constriction. In this case, there is no neck constriction. No. After sight of blood, it is happening. Right now? So remember here. So there are different types of syncope. Vasovagal, carotid sinus, which you have marked. So when I talk about a vasovagal signs by the sight of blood, by any kind of, like accident type or any kind of emotional trauma, stress, the sight of blood or standing for a longer period of time, then you can get what? Vasovagal syncope, right? No, carotid sinus syncope means what? When neck will be constricted, when carotid artery will be blocked, then you can see carotid sinus syncope, no? So here answer is what? C. Sudden drop in BP. Sudden drop in BP due to what? Any kind of trauma like sight of blood. Sight of blood. So answer is C here. I'm sure most of you would have done wrong here. In this manner, examiner would like to play with your knowledge, right? Next question. In a case of upper GI bleed, pantoprazole 40 milligram IV is injected. Pan 40, very commonly used drug, right? It is going to decrease further damage by blocking which of the ion channels? Basically, I'm asking you the mechanism of action, right now, of PPI, pantoprazole. PPI, when I say PPI, proton pump inhibitor, as per chemistry, what you have learned? Which is the proton here? Hydrogen ion. No, yahi to hai na, proton pump inhibitor. Now you can easily solve, no, mechanism of what? Pantoprazole, pan 40. Answer is B. B only, no? Answer is B. B for Bombay. Next question. A patient is presented with diabetic foot ulcer. On examination, wound looks dirty, old, and full of pus. Which of the following chemicals is more appropriate for this wound? Okay, this is called as a spirit. Spirit is nothing but 70% of alcohol. And this is actually betadine. Betadine, now you can say this is the povidone iodine. And this is H2O2, hydrogen peroxide. This is Dettol. Remember here in hospital, whenever we have to do antiseptic dressing, we are using some chemicals. Like suppose if I am using normal saline, okay, normal saline, especially to wash all kind of wounds. Wash, okay, washing. We are using betadine for all kind of wounds, like fresh and old. If there will be a fresh wound, please dilute the betadine first. Dilute the betadine first with the normal saline. Mix betadine and normal saline together, then you can clean it, right now? Okay, fine. We can also use H2O2, hydrogen peroxide, 1.5%. Hydrogen peroxide, this one. Hydrogen peroxide, remember here, especially for diabetic foot ulcer. When there will be a dirty wound, pus collection will be there. Remember, hydrogen peroxide is never used for fresh wound because it will burn the wound. So never use for the fresh wound, only for the old, dirty, where there is so much of pus collection. Okay, where actually when you see the wound looks also actually what? Old also, somewhat dry also, or maybe, like if there is so much of the pus collection. Basically, dirty wound, H2O2 is better option, right now. We can also use sodium hypochlorite. Where do we use sodium hypochlorite? Sodium hypochlorite. If there will be spillage of blood, or a spillage of pus collection, spillage of blood or a spillage of pus collection, and a spillage of pus over the floor, then use sodium hypochlorite. Sodium hypochlorite. Okay, I hope all these points are clear to all of you. Now, when I'm using 𝗲𝗋𝗋, one more liquid, 𝗲𝗋𝗋, very, very important. Glutaraldehyde, 𝗲𝗋𝗋, glutaraldehyde. 𝗲𝗋𝗋 is used for the sterilization of tube-like structures like endoscopy, cystoscope, right? Remember, all these points are important. Okay, fine. So here answer is what? D. Answer is hydrogen peroxide. Remember, here I have given a table. This PDF will be shared with you all, right? Remember, for operation theater fumigation, earlier we were using formaldehyde earlier to sterilize the operation theater for gas fumigation. But now for gas fumigation in operation theater, now we are using what? Glutaraldehyde with quaternary ammonium. Please remember, this is related to clinical microbiology. Glutaraldehyde 2%. This is called a what? 𝗲𝗋𝗋. 𝗲𝗋𝗋. Very, very important. Now, question number 27. While taking blood sample, a nurse spilled a few drops of blood on floor. Which of the following chemicals should be used to clean it? Just now I have explained. No. What is the answer? I'm telling you again, this is repeatedly asked question. We are using what? Sodium hypochlorite. Sodium hypochlorite. So how to clean the blood on the floor? First of all, you have to protect yourself. Basically, this is the work of the paramedical staffs. Okay, no? So first of all, PPE kit. You have to give proper instruction to the paramedical staff. First of all, PPE kit. Then a PPE kit, right? Remember here, PPE kit. After that, see here, with absorbable material, you are going to cover the spill. Now you are going to add sodium hypochlorite. In this manner, you have to disinfect, right now? So you have to see the amount of blood flow also, right now? So on an average, up to 10% sodium hypochlorite, right now? So like suppose if only one drop is there, then you can go with 1.5% also. All right. Remember sodium hypochlorite for blood spillage or pus spillage. Okay. See this question. A patient of pneumonia who is under the treatment for last 10 days has a fever with chills, nausea, vomiting, diarrhea. On examination, there is what? Tachycardia and rapid breathing and low blood pressure. So I can easily understand here that patient is having what? Increased heart rate and decreased blood pressure. It means what? Patient is going into shock. It means patient is going into shock, right now? So basically, which type of shock? Nausea, vomiting, diarrhea, I can say septic shock, right? What is the definition of shock? Remember here, when systolic blood pressure, you can say more than, when systolic blood pressure is less than 100 and pulse rate more than 100, it means patient is going into shock, right? Why not? After that, examiner is mentioning here, suspecting bacteremia with Staph aureus. Specimen should be collected from. Some of you might have marked sputum because you have seen only pneumonia. Okay, pneumonia hai, TB hai, lungs infection. Then okay, fine, sputum test. Patient is already on the treatment for last 10 days. Patient is now having what? A kind of sepsis. Suspecting bacteremia. Examiner has mentioned it, bacteremia. What is the meaning of bacteremia? Bacteremia means what? Bacteria in the blood. So, from where you are going to take the sample now? Now you have to do what? Blood culture. Remember, blood culture. Okay. Whenever there will be bacteremia, or if examiner is mentioning sepsis, right now, you have to take blood sample. Blood culture is needed. Sputum in the fresh case when you see any kind of, like a pulmonary infection. Remember like that. Very easy to understand. Answer is D, blood culture. Yes, so easily you can understand if there will be what? A UTI case, urinary tract infection, then you can take a urine sample. Respiratory infection, okay, sputum. Easy to understand. Bacteremia, sepsis, fever of unknown reason. It means what? Bacteria is there in the blood culture. Food poisoning hai, then you can take fecal matter as the culture, vomiting and the food, right? No? Carrier's case, nasal, perianal swab. Very easy to understand, right? Now, so this kind of vial culture, see here, this kind of vials are available in hospital. This can be your image-based question also. Remember here, these vials we are using for what? Blood culture in hospital. See next question. This question looks very big, but very easy for you. Microbiology question, clinical microbiology. A 55-year-old male is admitted to hospital. Can you answer? They go see this question. Read this question and try to solve, please. With complaints of what? Severe pain in lateral aspect of his left calf. And a small amount of pus discharge from the ingrown hair. Okay, ingrown hair. Okay, hair-related infection. Ingrown hair. On physical examination, local area is found to be red, warm, and tender. Pus is aspirated and subjected to gram staining, which is showing gram-positive cocci in clusters. What else hint you want? This is more than enough to solve, no? Cluster, see, culture on blood agar shows golden yellow pigmented beta hemolytic colonies. Where do you see all these? First of all, what? First of all, hair-related, skin-related infection, mostly Staph aureus. After that, gram-positive coccus, right now, and that too in clusters. And then what? Golden yellow pigmented beta hemolytic colonies. Of course, this is a case of what? All these features, where do we see? In a Staph aureus. Staph aureus. Remember here, all skin-related infection, hair-related infection, furuncle, carbuncle, SSS, right now, all these are related to what? Staph aureus. Remember here, this can be your image-based question, that when you do nutrient agar, okay, fine, this will show what? Yellow pigmented colonies. If you do blood agar, this will show what? Beta hemolytic. You can right now, you can highlight here. Mannitol agar, this will show what? Yellow colored colonies. All these are seen in Staph aureus, and this is repeatedly asked question. Staph aureus in microbiology, very important. Okay. Yes. Next question. A 30-year-old male presented in hospital with high fever, headache, drowsiness, mental confusion. Okay. On examination, neck is stiff. I think up to here only you have marked Neisseria meningitis. You have marked Neisseria meningitis, right? No? But this is wrong answer. Wrong answer. Because you did not read the question completely. Suspecting meningitis, cytopathological examination is performed, which detects what? Multinucleated giant cells, Zank smear. See a Zank preparation here. Multinucleated giant cells. Where do you see? Okay, yes, signs and symptoms are presenting what? Encephalitis. Encephalitis, no. But herpes simplex virus, this also causes endemic encephalitis, no, right? No. So symptoms, same symptoms of encephalitis that can be caused by herpes simplex virus also. How did you understand this part here? How do you understand? Where multinucleated giant cells will be seen? Herpes simplex virus. Answer is C, not A, right? You might have done mistake here. No problem. We have to learn here, right? Okay. So with the help of this kind of question only, you are going to understand how to be careful in solving the question. Now, when I talk about meningitis, what are the two physical examinations sign? Do you remember? 𝗵𝗺 sign and all. Please remember, very, very important. Kernig sign and 𝗵𝗺 sign related to meningitis. Okay, out of these four options, Where do you see ୱାଟରହାଉସ-ଫ୍ରେଡରିସିନ୍ syndrome? ୱାଟରହାଉସ-ଫ୍ରେଡରିସିନ୍ syndrome, where there will be what? Damage of adrenal gland. Patient can go into shock. Meningitis, right now? A. ୱାଟରହାଉସ-ଫ୍ରେଡରିସିନ୍ syndrome. Very, very important one-liner question, right? Sexual transmitted disease, gonorrhea, right? All these points are important. Next question. This is very easy for you. A 25-year-old male came with history of dysuria and noticed some pus-like drainage in his underwear and at the tip of his penis. He gave history of being sexually active with 6 or 7 partners in last 3 months. His physical examination showed a yellow urethral discharge and tenderness at the tip of penis. Examination of urethral discharge revealed intracellular gram-negative diplococci. Examiner is giving you all hints with plenty of pus cells. Yes, I can easily understand that this is a case of what? Sexually transmitted disease. When you see this kind of what? Yellow purulent discharge, no? So this is a case of what? Gonorrhea, Neisseria gonorrhea. But this kind of, this kind of infection can be because of non-gonococcal infection also. How will you understand? If there will be a watery discharge, then that will be what? A non-gonococcal infection. Non-gonococcal infection like chlamydial infection. So how to treat Neisseria gonorrhea? How to treat this gonorrhea? Drug of choice is what? First of all, remember here when I talk about gonorrhea, drug of choice is what? Ceftriaxone injection. Ceftriaxone. Okay. Or you can remember 3rd generation cephalosporin. Okay. With oral azithromycin. With oral tablet of azithromycin. Non-gonococcal infection, only azithro will be enough. Only azithro will be enough, right? So now you can easily solve the question. Remember here, how will you understand? If there is gonococcal urethritis, yes, thick discharge. Non-gonococcal, thin discharge, right? No, thin discharge. Remember here, very, very important. Repeatedly asked question. Next question. A young adult female was admitted to the hospital with intense headache, abdominal discomfort for past 7 days. She also had developed a fever which is of a remittent type with gradual rise in a step-ladder pattern, step-ladder fashion. On examination, she was found to be toxic and temperature very high, okay? Tongue was coated, mild splenomegaly. So when you see a step-ladder pattern, high fever with abdominal pain, where do you see? Mostly, what is the diagnosis here? Typhoid. Typhoid. You would have learned how to start investigation for typhoid, right? BASU. Mnemonic is BASU. 1st week, 2nd week, 3rd week, 4th week. B for blood culture. A for antigen test, Vidal. S for stool culture. U for urine culture. So since 7 days only, so answer is B. B, blood culture with Vidal test. Remember here, 1st week you have to do what? Blood culture and all. 2nd and 3rd week, right now, Vidal test. Vidal test. 2nd and 3rd week, Vidal test. Right now, Vidal test. We can also take a stool and urine culture. 4th week, stool and urine culture. Right? My question is that when I talk about typhoid, yes, why there is abdominal pain? Because Salmonella typhi. Salmonella typhi, where does it stay? It loves bile juice. It loves bile juice. Where there is bile, Salmonella would like to stay there. Bile juice. Fine, so hepatobiliary part. And also this is going to damage the lower part of the GIT. Fine, so abdominal pain will be there. My question is that, yes, enteric fever, typhoid. Which type of ulcer will be seen in typhoid? What will be the shape of ulcer in GIT part? When I say TB, tuberculosis, typhoid, and amoebiasis, Which shape of ulcer? Can you tell me? Remember when I say tuberculosis? No, yes, here there will be T for TB, T for transverse ulcer. Transverse ulcer. When I talk about the typhoid, there's a tie. There's a tie, longitudinal ulcer. Longitudinal ulcer. Amoebiasis, flask-shaped ulcer. Flask-shaped ulcer. Flask-shaped ulcer. Right? All these points are clear to all of you? Right. Very good. See, next question. While suturing a local wound, a surgeon got needle prick injury. Very, very common needle prick injury. No? Needle prick injury. So there is very high risk of transmission of hepatitis B, hepatitis C, and HIV. Remember, so what should be the right answer? What is the maximum risk here? Rule of 30. You can remember rule of 3. No? 30%, 3%, 0.3%. Okay. So most common, hepatitis B, then hepatitis C, then HIV. Okay, hepatitis B, 30% risk, right? Hepatitis C, 3% risk. HIV, 0.3%. So suppose if you are the surgeon and you got needle prick injury, you have to take the sample of patient for sure. Obviously, you might be very much scared. Oh my God, I'm talking about what? Local case. For the elective surgeries, obviously, we have to do viral screening in advance. For the local case, when you did not perform. So my question is that, are you going to take the sample of only patient, or your sample should also be going for that test? Please remember, patient sample will be going for sure. Doctor sample should also be sent. Why? Why? Because see, yes, your life is important. Obviously, patient life is also important. What if doctor is HIV positive? Might be. It can be possible, no? This can be possible, right? So sample of patient also and doctor also, both should be taken. Both should be sent to lab. Next question. Very important question. Here also, most of you would have done wrong. After needle prick injury, a doctor gets exposed to body fluids of the patient. Which of the following is the first step in post-exposure management? Some of you might have marked C, that as soon as possible, I have to take first dose. Some of you might have marked A, but answer is B. After needle prick injury, bleeding is there. And first of all, take first aid. First of all, take first aid. First aid. After that, report the nodal center. And then you will be getting what? Then only you will be getting what? Prophylactic dose, a tablet you will be getting. Very easy to understand. So answer is B. First aid first, no? First aid first, clean it first, right? Do dressing here. Very easy to understand. Wash it, clean it, dressing, important, right? Remember here, if you are taking prophylactic dose within 72 hours, very, very effective. But the most effective it will be when you are taking within 2 hours. Within 2 hours. Very important. Remember here, these are the steps of post-exposure management. And this is the protocol which you have to follow. Right now, which you have to follow. Next, this is pharmacology question related to, you can say, clinical pharma question. Answer, please. Okay, so when you have read this question, when you have read this question, morning stiffness in the fingers lasting for 30 minutes, swelling, tenderness, decreased range of motion, warmth, right, in the joint. Radiological image is also seen, like this also shown here. So there you can see erosion over, right, the joints here, right? So as per the clinical scenario, we can understand this is a case of rheumatoid arthritis. Rheumatoid arthritis. So we have to start the patient on disease-modified anti-rheumatoid drugs, DMARD. Remember, like sulfasalazine, methotrexate, right? There is a DMARD is a group of drugs, and this is having hepatotoxic effect. Hepatotoxicity is there. Fine, no? So before you start a patient on DMARD, first of all, check liver function test. Liver function test. In the same manner, if I ask you, suppose if you want to start a patient on a metformin, very, very famous drug, metformin, diabetic drug, right? No, diabetic drug, anti-diabetic drug. So metformin is having what? Renal toxicity. So when a patient is already on metformin, please keep on checking his kidney function test. Or if you want to start on metformin, check kidney function test, right? No, and in the kidney function test for the metformin, remember here, when this parameter, when I talk about creatinine, when it is more than 1.5, now metformin should be stopped. Metformin should be stopped, right? Now, see this question. A patient gets fulminant hepatic failure due to paracetamol poisoning. Paracetamol poisoning. Which of the following is the treatment of choice? Here also, I expect that most of you would have done wrong. What is the answer here? What is the answer? Basically, examiner is asking about what? Paracetamol poisoning, acetaminophen poisoning. Some of you would have, most of you would have marked A. A, no? Right? If examiner would have asked you, suppose if examiner would have asked you about drug of choice, for paracetamol poisoning, then answer would have been N-acetylcysteine. Antidote for paracetamol poisoning. Antidote for paracetamol poisoning, answer is N-acetylcysteine. If examiner would have asked you, what is the first line of investigation when a patient is getting admitted in hospital after paracetamol poisoning? Then answer would have been B. B. Right? Easy to understand? Now, but in this question, remember here, paracetamol will damage liver only. An examiner have mentioned fulminant hepatic failure. Fulminant hepatic failure. Liver is already gone. So what is the treatment of choice now? Answer is C, liver transplantation. Answer is C. I'm sure some of you would have done mistake, right? Or some of you would have done mistake. Remember here, what is the, no? Yes, very good. So what is the toxic dose of paracetamol? See, you would have seen about Dolo, right? No, paracetamol in so many houses. Everywhere it will be there. Fine. No? So when patient is taking more than 10 gram, or some books will be writing 12 gram. Okay, this is a toxic dose. Or you can say more than 20 tablets. More than 20 tablets. My next question, what is the most common indication of liver transplantation in adults? In adults, what is the most common indication of liver transplantation? Answer is what? Cirrhosis. What is the most common indication of liver transplantation in pediatric age group? What is the answer? Biliary atresia. Biliary atresia. Biliary atresia. What is the name of surgical procedure, temporary surgical procedure for biliary atresia? Do you remember? In surgery, you would have taught 𝗙cie procedure. 𝗙cie procedure. If you remember it, 𝗙cie procedure. Now, what is the most common indication of liver transplantation in acute condition? Acute. Paracetamol poisoning. Paracetamol poisoning. Now, I hope this question is clear to everyone, right? See next question. See this question, very easy for you, and try to answer. Okay, what is the answer here? One night before an elective cholecystectomy, patient is scared, anxious, and not getting sleep. Basically, patient is getting anxious. No, anxiety is happening, right? Anxiety. Yes, it's very common. One night before the surgery, patient can have this kind of thought process that tomorrow surgeons will open my abdomen. After that, whether they are going to close it back or not, I'm not sure, right? So anxiety to hoga, right? No, so that's why one night before, nurse will give 0.25 milligram of oral alprazolam. Alprazolam is nothing but benzodiazepine, right? No, benzodiazepine is what? Anti-anxiety drug and sleeping pills, right? No, sleeping pills. So answer is C. Very easy question, no? Next question, pharmacology question. A 49-year-old diabetic and hypertensive patient taking several drugs presented with septicemia, serum creatinine level. This is what? 5.9 milligram per deciliter. Oh my God, this is very, very high. Remember here, more than 1.5 serum creat will be there. No, we should stop metformin. Do you understand here that out of these four drugs, especially we have to check for, first of all, we have to look for what? Kidney, no? Kidney, first of all, right? No? Kidney, right? No? So which drug should be stopped? Metformin. Metformin is contraindicated in a case of renal toxicity. Remember, pharmacology question will be like this only, where you have to rule out, right? So especially metformin, first you have to stop. Next question. Mr. Sham has to go to Delhi next day morning by the car. He has history of dizziness, lightheadedness, and nausea, vomiting while traveling. Basically, this is a case of what? Motion sickness, no? This is a case of motion sickness, right? Motion sickness only. Motion sickness only. So out of these four drugs, which one is better option? You are giving a transdermal patch here, no? Dermal patch to keep just behind the ear. Which one? Scopolamine patch only, no? Answer is what? Scopolamine patch. Scopolamine patch, right? See, in this manner, you help the patient for motion sickness disorder. Next question. This is also pharmacology question, but related to medicine. An obese patient, obese diabetic woman, was on failed metformin therapy. She has history of pancreatitis. History of pancreatitis. Family history of bladder cancer. Family history of bladder cancer. She is not willing to take injection. Now, which of the following drug would be suitable to decrease her glucose level? See here, examiner has given all the options here, all the points here. That first of all, she is obese, failed metformin, history of pancreatitis, right? No, and family history of bladder cancer also. And she is also not willing to take injection. Then you have to rule out. Remember, all gliptin, sitagliptin, linagliptin, this can cause pancreatitis. So this is rule out. Remember, one anti-diabetic drug which is given with black box warning, pioglitazone, because it can cause bladder cancer in future, So see here, any drug which is having severe side effect, risk of severe side effect, that should be given with black box warning. So pioglitazone can cause bladder cancer in future. Now, out of B and C, remember here, liraglutide, we have to give subcutaneous injection. Now, she doesn't want to take the injection. So which drug can be taken orally here? Answer is C. I remember here, see here. So this is what? SGLT2 inhibitor, right? Sodium glucose link transport. I know. So this has some good effects here, because this can decrease the weight also. This can decrease a lipid also. right? See here, what are the benefits? This can decrease blood pressure, uric acid, weight also, because these drugs are what? See here, all SGLT2 inhibitors. These are what? Neutral to lipid, neutral to lipid. Remember it, very, very important, very, very, so remember here, when I talk about that drug, I don't see here, when I talk about this pioglitazone, this can cause what? Bladder cancer. You can remember here one more drug, which is osteoporotic drug, teriparatide. This is also given with black box warning because it can cause osteosarcoma in future. Remember, this is what? Osteoporotic drug. So remember here, in this manner, examiners are framing the question. Now, when I talk about this drug, SGLT2 inhibitors, see here, so basically glucose linked, sodium glucose linked transporter. Patient can frame the question in this manner also that, so the examiner can frame in this manner like, patient was on anti-diabetic drug. And now patient is having UTI, urinary tract infection. Which diabetic drug she would have been taking? Right? So remember here, now UTI side effect, which drug? SGLT2 inhibitor. Remember here, this is the side effect of what? SGLT2 inhibitor. So in this manner, examiner will try to trap you. Okay, fine. So answer is C. Next question. Here also I'm suspecting that some of you would have done mistake. A 70-year-old male has difficulty in urination associated with increased urge and frequency. He has to get up several times in night time to relieve himself. Okay. So now you can easily understand that this is a case of BPH, benign prostatic hyperplasia. So answer is hyperplasia. You would have marked hyperplasia. You would have marked hyperplasia because this is a case of BPH only. But is this the question? Read the question completely. On rectal examination, he has enlarged prostate. Okay, fine. BPH case. But what is the question? Which of the following represent the most likely change in the bladder? Examiner is asking about the bladder change, not prostate. This is the bladder. This is prostate and this is urethra. This is bladder, this is prostate, this is urethra. Remember here, if examiner would have asked you about prostate, then hyperplasia, examiners have asked you about what? Change in bladder. If you work against the resistance in gym, against the resistance, there will be hypertrophy of muscles. So here examiner has asked about what? Change in bladder. Bladder, see here in BPH, what will happen here? There will be the constriction here. There will be what? Prostatic hyperplasia here. So there will be difficulty in passing the urine. So bladder has to work against the resistance. Remember here. So answer is what? Hypertrophy, change in bladder. Answer is B. Remember, easy question or not? Basically surgery question related to pathology. But easily students can do mistake. Moral of the story, read complete question. Next question now. A young boy is presented to emergency with complaints of red rashes over his body. Red rashes over his body and difficulty in breathing. He gives history of having food at hostel. Basically, this is a case of food allergy. Food allergy, right now. So any kind of allergy, which type of hypersensitivity reaction, type 1, type 2, type 3 or type 4? Answer is type 1 hypersensitivity reaction, right? Type 1 is what? Anaphylactic type. Yeah, this was easy question. I'm sure most of you would have done right here. Remember here, type 1, type 2, type 3, and type 4. All these are all hypersensitivity reactions in pathology. Very, very important for your exam. Please revise and memorize it. Very important. Now, endoscopic findings of lower esophagus is shown here. which is in response to GERD, gastroesophageal reflux disease, where a type of epithelium is replaced by another epithelium. So can you tell me which type of changes will happen in this case? Basically, this is a case of what? This is a case of what? Can you answer me? This is a case of Barrett's esophagus. This is a case of Barrett's esophagus. This is a case of what? Columnar metaplasia. This is a case of what? Columnar metaplasia. Columnar metaplasia, right? Remember, columnar metaplasia, right? So the answer is C. This is a case of Barrett's esophagus. Very important. Next question. During the surgery of thyroid tumor of a patient, a small yellow gland got incised accidentally. So near the thyroid gland, which yellow glands are there? Parathyroid gland, right? So examiner is talking about what? Parathyroid gland. Afterwards, patient is complaining of having tingling sensation and twitching in hands, feet and face. Basically symptoms like the tetanus, no? So when this yellow gland will get damaged, parathyroid gland, basically parathormone, that is balancing what? Calcium only, no? Calcium, right? So these symptoms will occur when there will be hypocalcemia. Hypocalcemia, like, right? Answer is B. Decreased level of serum calcium, no? Hypocalcemia. My next question related to surgery. Related to surgery. Now, suppose accidentally, if there is incision of this yellow gland, what is the next line of management? What will you do next? Can you answer me? Are you going to throw in dustbin? Or are you going to present it to your nurse? Or you are going to do something else? Retransplantation, right? No, retransplantation, right? No. So basically what you are going to do here, remember here, you are not going to throw, right? No. So parathyroid gland, when it will be removed accidentally, no, you can reimplant accidentally reimplant at sternocleidomastoid muscle, or when you have to do incision in a case of hyperplasia there, no. So remember here, reimplant where? Under which muscle? Under brachioradialis muscle, under brachioradialis muscle of non-dominant forearm. Non-dominant forearm. Remember it. Okay, no? Reimplant parathyroid gland either at sternocleidomastoid muscle or brachioradialis muscle of non-dominant forearm. Next question, a 35-year-old unmarried female complains of lack of energy, sadness, lack of appetite, insomnia, and feeling of guilt for last 1 month. She gives the history of weight loss also. Thyroid profile is normal, ACTH is normal, everything is normal. Clinician wants to assess her neurotransmitter level. So can you answer this question now? Why neurotransmitter level? Because the thyroid profile is normal, ACTH is also normal. Remember here, when you see this question, this is a case of depression. Depression-like symptoms can occur in thyroid case also, and when there will be hypersecretion of the cortisol. But these tests are normal. No? So 100% patient is suffering from depression, where minimum C equal to or more than 5 symptoms should be there for more than 14 days. Okay, no? So what are the symptoms? Lack of mood, lack of food, lack of sleep, lack of energy, lack of attention, weight loss, anhedonia, suicidal thoughts, negative thoughts, feeling of guilt, right? No? These are the symptoms of depression. Out of these symptoms, minimum equal to more than 5 symptoms for more than 14 days, 100%. This is a case of depression. Remember here. So which neurotransmitters are important here? Remember serotonin, serotonin. I will write again. Remember, serotonin, norepinephrine, and dopamine. Decreased level of these neurotransmitters in a limbic system. In limbic system will cause depression, and increase the level of these neurotransmitter will cause psychotic symptoms. Simple hai. So most important neurotransmitter for depression, serotonin and norepinephrine. We have learned about serotonin, that serotonin is responsible for good food, good mood, and good sleep. That's why serotonin is called as happy hormone. Decreased level of serotonin can cause depression. Simple. That's why you want to increase the serotonin with the help of SSRI, which is the drug of choice for depression. What are the SSRIs you are able to recall? Can you give me one example of SSRI? Fluoxetine, especially remember fluoxetine. SSRI. Fluoxetine, right? Fluoxetine, sertraline, escitalopram, dapaxetine, paroxetine. All these are SSRIs only. Right now, remember here, very, very important. Okay, find some neurotransmitters. When you abuse any substance, you get kick. This is because of which neurotransmitter? Dopamine. Please write down. Dopamine is responsible for kick. A person feels reward, pleasure, and person gets addiction to any substance. That is because of what? Dopamine. Serotonin is called as happy hormone, right? Norepinephrine, this is responsible for alertness and arousal. So if a person is very, very sad and there is no alertness, if SSRI is not working, can I try SNRI? SNRI for depression? Yes. Here we can increase the level of serotonin also, norepinephrine also. No? So remember, what are the examples of SNRI? Venlafaxine and desvenlafaxine. Desvenlafaxine. The question is that what is the indication of starting a patient on SNRI? When there will be lack of motivation in the patient, lack of drive, and a lack of energy, then you start your patient on SNRI. But remember, overall drug of choice for depression is what? SSRI. Acetylcholine, when you smoke a cigarette, after that you are having good attention, good concentration. No? So acetylcholine is responsible for good attention, good concentration, good judgment power, good memory, good learning, good mathematic ability. This is all about acetylcholine, right? So you can say acetylcholine is what? Attention hormone, right? Attention hormone. I hope all these points are clear to all of you. Remember, acetylcholine, this also enables muscle action. This also enables muscle action. One clinical correlation related to acetylcholine, even in Alzheimer's disease. Even in Alzheimer's disease, there is what? Degeneration of neurons producing acetylcholine, right? All these are what? All these are integrated topics, right? Okay, next question. A 40-year-old female is complaining of tingling sensation over the arm. She was watching TV for long hours with hands under the head. Which type of nerve fiber is most likely to be affected? Basically, nerve fibers, because of the pressure, pressure, right? Pressure. So A is more than B is more than C. Remember A. Remember here, very, very important. Tingling sensation is due to pressure. Most susceptible fibers for the pressure is what? Type, this is A, B, and then C. Answer is A. Next question. Biochemistry question. A person is on fasting, no? Fasting for last 4 days. Right? Urine test is performed and this is the result. Fasting for last 4 days means what? Severe starvation. Severe starvation. So obviously in the body, there will be metabolic changes. No, there will be secondary changes due to what? Starvation, right? No, because there will be depletion of glucose. After that, there will be use of what? Free fatty acids. And finally, last source of energy will be what? Ketone bodies. Ketone bodies, right? No, ketone bodies. So now if you do urine test, if you can find a purple ring like this, which test? It is called as Rothera's test. It is called as Rothera's test. Rothera's test, which is being performed for ketone bodies. Answer is ketone bodies. Remember, starvation is an important topic in physiology and biochemistry. Very, very important, right? No? Okay, fine. Can you answer me, where do we use a biuret test? Where do we use Benedict test? Can you answer me? Bolo, important hai. Biuret test for protein. See this part. This is called a biuret test. Purple color. This is especially for protein. If you can see purple ring here like this, Rothera's test for ketone bodies. And this kind of orange, right now, Benedict test for sugar. These three are important image-based questions in biochemistry. Okay, so some other tests for ketone bodies, can you tell me, which you have learned in your biochemistry? First important is Rothera's test. First important is Rothera's test. Where you can see what? Where you can see what? Purple colored ring. Right now, when it will be mixed with the solution of sodium nitroprusside, right? Now, if you are going to add a ferric chloride to urine, brownish red color, that is called a Gerhardt test. Now there will be a strip which is coated with sodium nitroprusside. If you are going to dip in a urine, it will turn into purple color, right? No, the strip, reagent strip test. Remember Rothera's test, Gerhardt test, and a strip test. These are for ketone bodies. Ketone bodies. So there are three types of ketone bodies which you have learned right now: acetoacetic acid, acetone, beta hydroxybutyric acid. Please remember, all these are what? Important. All these are important. You would have learned in biochemistry. So ketone bodies will be formed what? After metabolism of what? This is after incomplete metabolism of fat. Fat. Remember all these points. See this question. This is image-based question. This is important. If you can understand this kind of question, it means you are ready for MCI exam. Pakka, you are ready. It means your understanding is good now. This is related to a starvation. Which of the following changes you can see here? You can easily understand. No? So during a starvation, just now I've explained, there will be depletion of what? Glucose. First of all, glucose will go down. After the free fatty acid, and then that will also go down. Finally, see here, so during a starvation, there will be what? Increased level of ketone body. So which one is, so when you see this image, which one can indicate increased level of ketone bodies during a starvation? Answer is C. Biochemistry question. Next, this is also biochemistry question. I would suggest all of you, remember in biochemistry, these days, most of the questions, they are framing from vitamins. After that, amino acids. After that, amino acids. After that, fat and, fat and glucose. So especially one question will be there from glycolysis. TCA cycle. TCA cycle is very, very important. No? TCA. Okay. So yes, these are important. Read this question and try to solve. After 50 question, we can take a small break, okay? A case of short bowel syndrome due to terminal ileum resection presents to your clinic with difficulty in breathing, fatigue, diarrhea, nausea, and loss of appetite. Glossitis also. Tingling sensation in the limbs. First of all, I can say, okay, this is a case of what? Megaloblastic anemia. This can be due to deficiency of what? Folic acid and vitamin B12 also. What is your answer? What is the function of B12? What is the function of B12? Myelination of nerves. Myelination of nerve, right? No, myelin sheet for no myelination of nerves. Because of this, there will be what? Smooth conduction. Smooth conduction. Okay. So remember here in this question or anywhere where there can be the deficiency of vitamin, where there will be neurological symptom. If a neurological symptom is there, like tingling sensation, no? If a neurological symptom is there, then answer will be vitamin B12, 𝗖𝗵𝗶𝗯𝗃, right? But what is the integration of this question with surgery? Because examiner has mentioned here what? Short bowel syndrome. Because of what? Resection. And because of what? Removal of what? Terminal ileum part. What is the function of ileum, by the way? What is the function of ileum? This is large intestine. This will be what? Ascending colon. This is ascending colon. And this portion is called a terminal ileum. Terminal part of ileum. What is the function of terminal ileum? Reabsorption of vitamin B12 and balancing what? Bile juice. Bile juice. How much is the length of short bowel? How much is the length of a small intestine? 6 meters. In a case of irritable, in a case of what? Inflammatory bowel syndrome like Crohn's disease or ulcerative colitis, if you have to dissect a big portion of the intestine, okay, no, fine, no, right? Or in any condition, any pathology where you have to remove a big portion of intestine, and after that, length of intestine is less than 2 meters or 200 centimeters. This will be called as what? Short bowel syndrome. Short bowel syndrome. Short bowel syndrome. So remember here, when there is what? Resection of terminal ileum, there can be deficiency of vitamin B12. When there is imbalance of bile juice, do you think there is a risk of gallstone formation? Yes. Yes, removal of terminal part of the ileum can cause gallstone formation also, because it will cause imbalance in bile juice, bile salt, bile acids. Easy to understand. I hope you are able to understand all these. Next question. An alcoholic malnourished patient present to emergency room with respiratory distress. His pulse rate is high, pedal edema, hypertension, systolic murmur, along with bilateral crepitation. A diagnosis of congestive high output cardiac heart failure. Remember, very easy to understand. Alcoholic also, beriberi also, right? Now, beriberi you can easily understand. So which vitamin deficiency can cause? Vitamin B1, vitamin B1, thiamine deficiency, right? No, thiamine deficiency, right? I hope these points are clear to all of you. Okay, fine. So we can stop here. So we can take a small break. Now we can take a small break because this is the lunchtime. Most of you will be hungry. Right now, we can take a small break, but only for 10 minutes, please. Only for 10 minutes. Okay. Right. Only for 10 minutes. Please come back soon. See, so we can start the session by 3:10 p.m. Now in India, it is 3 p.m. We can start after 10 minutes. Okay, fine. We can start now. Chalo, everyone. Since this is Diwali day, so mostly I would like to finish by 5 o'clock. We can easily finish. Don't worry about that. Okay. After so you can use that day also up to 5. You can learn, and after 5 you can get ready for Diwali celebration. Okay. So now, chalo, everyone. What is the answer? What is the answer of this question? What is the size of ivy cannula shown below? This is pink color. No, this is pink color. See here, no? Like this kind of question is repeatedly being asked. Okay. So how I used to memorize? See, every time I used to memorize, like every time I used to keep in mind about green color cannula. That is 18 gauge. 18 gauge. And after green, pink color, then blue, then yellow. Okay. After green, gray color, and then orange color. See, when you increase the gauge here, right? Size will be decreasing. This is pink is 20 gauge, blue 22, yellow 24, gray 16. So these are large size, big size, big bore gauges, right? Big bore cannulas. Orange 14 gauge. One more is also there, like you can say violet color, or you can say violet or the purple color, no? Purple color for the babies, size is 26. So remember like this. So remember here, this is very, very important. So here, this is pink color. So answer is B here, 20 gauge. So in this manner, they are framing the question. Now you can easily, mark here. Say this is 18 gauge, pink, this is 20 gauge, blue, 22, yellow, 24. Okay, very easy to understand. Next question, after a midline laparotomy, you have been asked to suture the incision. What length of suture material will you choose? You are in operation theater, you have to ask the nurse to give you suture. So how much should be the length of suture you should be choosing for suturing the wound? Remember, there is a rule that is called as Jenkins rule. Jenkins rule in surgery, you will learn general surgery, that you have to multiply the length of incision with 4. Okay, with 4. Fine. So answer is B. Suppose if length, see, wound length is 4 centimeter. Wound length is 4 centimeter. How much should be the length of suture which you should be choosing? 4 into 4. Answer should be 16 centimeter, right? I hope this is clear to all of you. This is called as Jenkins rule. Next question. A clinician is performing a test as shown below. In which condition this test will be positive? See, this test, what is happening is, suppose if a patient where you suspect there is what? Accumulation of peritoneal fluid, right? No, peritoneal accumulation, where you suspect ascites, alcoholic patient. So what is happening? We are asking the patient to keep his hand over the abdomen as shown in this photo, right? As shown in this photo. And after that, we are going to apply pressure here. When pressure will be here, no, like this, no. So and after that, there will be what? See, there will be what? Release of a wave like this. Right now, release of a wave like this over the abdomen, you will feel. This is called as which test? This is called as fluid thrill test. Fluid thrill test, very, very important. This is seen in a case of what? Ascites. In a case of ascites, right now, ascites. So see here, you should expect some basic clinical practice of hospital. Okay, basic clinical practice question of hospital. So this is actually a very easy thing to understand, and you can easily solve this case. Next, a patient met with a road traffic accident. He brought to casualty on a stretcher with multiple fractures. First of all, you understand here, multiple fractures, severe bleeding, On examination, he is found to be disoriented. Blood pressure is 90/60. It means what? Patient is going into shock. Related to road traffic accident or related to trauma, you can expect 4 questions in exam. Always remember that whenever you have a patient of road traffic accident or any emergency, first of all, you have to maintain what? A, B, C. Airway, breathing, and circulation. How will you understand that circulation has some problem? For this, what is the first investigation to be done to check if patient is having some problem in this, like in the circulation? Because of that, patient can go into shock. What is the first? It is what? Blood pressure, BP, right? No, BP. If patient is having BP, means 90/60, it means what? Patient is going into shock. So after that, how to manage? Yes, you have to give what? Bolus of IV fluid. Means fast infusion of minimum 1 liter of normal saline. Okay, basically IV fluid. As per the condition, you have to choose the fluid, normal saline or ringus lactate, as per the condition. Okay, fine. Now, what question they are asking? Suppose if you have given bolus of fluid, but there is no improvement in the symptom, there is no improvement in the blood pressure. What does it mean? It means the fluid which you have given is not reaching to the normal place, no? So what is the most important parameter to check if the fluid which you have given is adequate or not? What is this? Urine output. Urine output and blood pressure. Urine output and blood pressure. Very easy to understand. So here in this case, patient is having bleeding also, multiple fracture also, and patient is going into shock also. So what should be the better first line management out of these 4 options? Start the patient on IV infusion and do pressure bandage so that you can stop bleeding also. You can easily understand all this, right? Okay. Now, question number 55. After a 40-story building collapsed, 150 people were injured, 70 people had multiple bruises, but they can walk. 25 seem to have a rib fracture, and these are facing difficulty in breathing. And next 25 people had severe head injuries, and they appear to be unconscious and immobile. And last 25 people had fractures over forearm and legs with crush injury. Which of the following cases you will give least priority? Least priority. Here some of you have marked B answer. Some of you would have marked B answer, right? But that is wrong answer. B is wrong. Remember, this is a case of what? Disaster management, where you have to understand about triage, right? We have to categorize the patient as per severity. Okay? As per the severity. Out of these 150 people, see, remember here, the patients who need immediate intervention, who needs immediate intervention. So out of these ABCD, D needs immediate intervention. So D can be categorized in the red zone. Red zone. Remember here, normal pneumonic RIG-B. Red color, yellow, green, and black. These 4 are most important, right? Now, so these 4 should be there for sure. These 4 minimum. These 4 color. Okay, these 4 color. So patients who need immediate intervention should be categorized as red zone. After that, who needs intervention within a few hours, where if you do not intervene the patient within a few hours, patient can get what? Amputation. You will have to do amputation. You will have to remove his, major joints and all. So they also need intervention as soon as possible, right now. So option number C, yellow color. And green color, patients who need intervention in 1 day, who can walk, maybe we can wait up to 1 day. Green zone, green zone, green zone. But what about black zone? Black zone, remember here, black zone color means what? Moribund or almost dead. Because whenever there will be disaster management, when there will be so many people, when so many people got like injured, so at that time Like that time, you should not be spending a lot of time on those people who are already dead or who are about to die, because say you're within short span of time, you have to take care of so many patients. No, so black zone, least priority, least priority, least priority, where patients can be almost moribund or almost dead, right? No, almost dead patients. So don't waste so much time there. Very easy to understand. So least priority should be given to A, and maximum priority should be given to option number D, red zone, like if there'll be pneumothorax and all, right? Very easy to understand. I hope all these points are clear to everyone, right? Red, yellow, green, and black. Rig B. Minimum these 4 colors you have to keep in mind. Very, very important. This is for disaster management. This is called as triage, right? Very, very important. Now, what about this question? A 70-year-old male presents for the first time with complaints of dribbling of urine. Dribbling of urine, frequency and hesitancy. On examination, his prostate is enlarged. What is the first line of management? See, all of you, and now I'm not able to see your chats. So suppose, so let me finish the discussion first. If you will be having any confusion in any question, you can text me. You can text on the Arise groups also, right now. So after that, I will give the explanation. And don't worry about the PDF. PDF will be shared with explanation to everyone. Okay, fine. Now, this is a case of BPH, benign prostatic hyperplasia. Okay, so what should be the first drug to be given first line of management? Remember here, we can give 2 drugs, alpha blocker also, and we can give what? 5-alpha reductase inhibitor also, 5-alpha reductase inhibitor also. Okay, fine. Remember here, when I talk about 5-alpha reductase inhibitor, no, 5-alpha reductase inhibitor, say here, basically dihydrotestosterone 2-testosterone. Remember, this is also responsible for the formation of BPH, benign prostatic hyperplasia. Okay, fine. You also want to block this part, right? No, fine. But when you are starting 5-alpha reductase inhibitor drug like finasteride, you would have learned finasteride, right now. So when you start this drug, no, okay, see that testosterone which is already formed, it will take at least 1 month to go completely. So whenever you are giving 5-alpha reductase inhibitors, no, so this can help the patient after 1 month. As per the question, what is the first line of management? Patient is having so much problem. I know. So you give a muscle which can relax the prostate part there, which can relax the smooth muscle. So answer is what? Alpha blocker to be given. Alpha blocker to be given. Remember here, answer is B. Alpha blocker to be given. So what are the examples of alpha blocker? Do you remember? Do you remember? So many drugs are now very commonly used drug. Remember here, prazosin, terazosin, tamsulosin. I know all these drugs, very easy to understand. So these drugs are going to help the patient immediately. Remember where you have learned about prazosin in forensic science? Somewhere in a snake bite, nearby a snake bite, somewhere. Scorpion bite. Remember prazosin, scorpion bite. Scorpion bite, if you remember all these points. So remember here, say here, when you are able to recall, whenever you are able to integrate all these, no, in this manner, you can improve the memory also, right? So first line of management for BPH should be what? Alpha blocker. Next question. After treatment for glaucoma, a patient comes to emergency department with acute bronchial asthma. Which drug might have caused it? If there is a glaucoma patient, you would have learned in pharmacology part when you were learning about ANS drugs, right? Glaucoma drugs which can increase UV scleral flow. All glaucoma drugs are important for the exam. So remember here, the glaucoma drug which can precipitate asthma, which one? Beta blocker, right? Now, beta blocker. So what is the answer here? Out of these, answer is what? Timolol. Answer is timolol. Next question. A 56-year-old female presents in emergency room with breathing difficulty. It is informed that See, it is informed by the attendants that she is taking medications for hypertension and congestive cardiac failure. And suddenly she has developed what? Skin rashes, along with swelling of tongue, swelling of lips, as well as eyes, swelling of tongue and lips. So because of that, there's difficulty in breathing. Do you remember patient is on the treatment of what? Hypertension and congestive heart failure. So overall, what is the diagnosis here? What is the diagnosis? Swelling of tongue, lips, breathing problem, eyes also, right? Eye swelling also here. What is the diagnosis? Can you answer me? This is a case of what? Angioedema. This is a case of what? Angioedema. Please remember, angioedema. Which drug can cause angioedema? You would have learned ACE inhibitors. You would have learned side effect of ACE inhibitors, right? ACE inhibitors, all pril type, no? Captopril. Easy to understand. So what are the side effects of ACE inhibitor? You would have learned angioedema and cough, hypotension, neutropenia, and also, right? No, there can be imbalance in potassium also. So remember here, all ACE inhibitors, keep in mind, ACE inhibitors like captopril, lisinopril, these drugs are important, especially for exam. They are asking side effect of these drugs. You can understand here. See, when you see these photos, you can easily understand, okay, this is what? Drug causing angioedema. Drug causing angioedema. So now you can easily rule out. Now you can easily solve this question, right? Okay. Next question. A 48-year-old female presents with symptoms of acute cholecystitis. Okay. Acute. Symptoms are controlled with medical management for last 2 days only. On ultrasound, there is solitary gallstone of 1.5 centimeter. Which of the following is the most appropriate step in the management? Are you going to follow up? Or only antibiotics will be enough? Or you are going to operate? Answer, please. Answer, please. See, remember, this is a case of what? Gallstone. This is a case of cholecystitis, no gallstone here. So remember here, first of all, when to operate and when to abort the surgery. This you should know. If patient is presented within 72 hours, if patient is presented within 72 hours of acute pain, operate. You have to operate as soon as possible. Within 3 days, operate. If patient is presenting to your department after 72 hours, after 3 days, please cancel the surgery. Now don't perform surgery. Now postpone this surgery for 6 weeks. You have to postpone this surgery. Postpone this surgery. Don't operate now. Postpone this surgery. Okay? Fine. For 6 weeks, you have to keep the patient on fluids, analgesics, and antibiotics. Why you are not supposed to operate it now? Because there will be what? Severe inflammation, and when you operate, there will be very high risk of adhesions and all. So that will be more dangerous for the patient. So that's why you want to subside it first. So wait for 6 weeks. Patient should be under antibiotics and analgesics, and fluids should be given, right? No, after 6 weeks, after 1.5 months, you call the patient for surgery. This is the protocol. Since this patient is presented within 2 days, no, means within 72 hours, so you have to operate. Okay? So now either option should be C or D. Now, when will you take the decision that you have to perform open surgery or laparoscopic surgery? Open or laparoscopic? Overall, if examiner is asking you what is the gold standard treatment for cholecystitis, right? No, so laparoscopy. Laparoscopic cholecystectomy is what? This is gold standard. But when will you take that decision? Remember here, When patient looks stable, when patient is stable, vitals are stable, then please go for 𝗲𝗃𝗃𝗃. Go for 𝗲𝗃𝗃𝗃. But if patient looks unstable, remember here, if patient looks unstable, first of all, unstable, or with other comorbidities like coronary artery disease or severe diabetes mellitus, or any kind of respiratory problem, serious respiratory problem, or a patient is very much old, where patient looks unstable, in these conditions, you have to go for open cholecystectomy. And even one more indication of open surgery, when surgeon is not that much skillful, when surgeon is not that much skilled, okay, no? So with the skilled hand, laparoscopy is always better. Easy to understand. So in this case, where she looks perfectly fine, okay, vitals are also stable here. Basically, in the question, there is no any correlation of diabetes. There is no any correlation of diabetes or what? Old world, right? So answer is D. Answer is D. Which gas is used during laparoscopic surgery to increase the space? Carbon dioxide is used. Okay. Carbon dioxide is used. So answer is D, laparoscopic surgery. Next. A 21-year-old female presented with patchy hair loss in the right temporal and occipital region. Examination revealed a non-scarring alopecia with multiple small broken, first of all, non-scarring alopecia and multiple small broken hairs, right? Scrapings from a scalp showed mild inflammation, perifollicular hemorrhage, and surrounding mild lymphocytic infiltration. What is the most likely diagnosis? Okay. This is the question from dermatology, skin, derma question. Derma question. Non-scarring alopecia and multiple small broken hairs and a young female. Right now, so mostly this is a case of what? Hair pulling disorder. Hair pulling disorder is called as what? Hair pulling disorder. This is called as what? When a person is having this kind of, this kind of obsession that person keeps on pulling the hair. Right now, this is called a what? Trichotillomania. Trichotillomania. Very, very important. This is called as what? This is called as trichotillomania, hair pulling disorder. Remember earlier, this was the type of impulse control disorder, psychiatry also, impulse control disorder. But now trichotillomania is a type of OCD as per ICD-11. As per ICD-11, this is a type of OCD. And remember here, after hair pulling, if a person can eat, it is called as eating the hair. It is called a what? Trichophagia. It is called as trichophagia, eating the hair. After that, do you think there can be hairball obstruction in GIT? Yes, hairball obstruction is called as what? Trichobazor. That is called as trichobazor. Hairball obstruction. Hairball obstruction. Trichobazor. So what can be the complications of trichobazor? Okay, one, obstruction, second, abdominal pain, and because of what? Hair, fine hair, so there can be GI epithelium damage also, no? So GI bleeding also. How to treat trichobazor? Trichobazor, surgery, surgical removal. Please remember, hairball obstruction is called a trichobazor. Sometimes you can see psychiatric patient who can eat a raw vegetable like this. So there can be obstruction by the plant material also, vegetable material also, no? So accumulation of vegetables, that is called a phytobazor. Phytobazor. Phyto means plant. I hope all these points are clear to all of you. Remember, yes, so trichobazor. So this kind of thing, this is also called what? Rapunzel syndrome. Rapunzel syndrome. You would have learned in surgery also. Stone formation in gallbladder is enhanced by all except. You would have learned in surgery that, see, there are three most important factors for the formation of a stone in gallbladder, right? First of all, gallbladder. See, first of all, what? Stasis, immobility. Any condition where patient is immobile, okay, fine. After that, bile juice imbalance. Bile juice imbalance, bile salt, bile acid. And third point, nucleation. 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 Right now, so mean to small crystals will be collected together. So when these factors are there, yes, there is what? Very high risk of what? Gallstone formation. Gallstone formation. Remember here, when I remove ileum part, I have explained you right now, ileum part here, this part, this is responsible for what? Bile juice, right now, maintenance. So yes, this can cause gallstone. This medicine can cause, this can decrease, right here. Just a minute. Okay, fine. So even this drug, yes, this can also cause a stone formation. High calorie diet, cholesterol diet, bile acid and all, right? But what about option number C? What about option number C? What about a vagal stimulation? Vagal stimulation, what it is going to cause? Vagal stimulation. Can you answer me? I hope all of you know this fact that vagus nerve is supplying. See, know this fact that vagus nerve is supplying the stomach part also, right now. So what vagus nerve does here? Can you answer me? Dekho, first of all, there will be division of vagus nerve, like one right side, one left side. Remember, division of vagus nerve just behind the esophagus. So mnemonic is LARP, LARP. Remember, left division of left vagus nerve will be supplying anterior part of stomach, anterior part of stomach, and a right will be supplying the posterior part of stomach. This is posterior part, LARP. Remember here, left division will be supplying the anterior part of stomach, and a right division will be supplying the posterior part of stomach. Okay, fine. So first of all, vagus nerve function is what? This is going to stimulate what? Parietal cells. This is going to stimulate what? Parietal cells. Parietal cells. What is the most common location of parietal cells? In which part of the stomach maximum parietal cells will be there? Can you answer me? Physiology question. Maximum parietal cells where? In the fundus part. Fundus. Then body. Then antrum. Then pylorus. Then duodenum 1 and duodenum 2. So maximum location of parietal cells in fundus part of stomach, fundus. So because of the parietal cells only, there will be secretion of hydrochloric acid. So whenever there will be stimulation of vagus nerve, there will be hypersecretion of hydrochloric acid, hypersecretion of hydrochloric acid. That's why when you have a patient of peptic ulcer disease, like gastric ulcer and duodenal ulcer, gastric ulcer, 5 types of gastric ulcer. If you are able to recall your surgery part, 5 types of gastric ulcer as per Johnson classification, 5 types. Type 1 at angularis incisura. This is a type 1. One more here, beginning part of the duodenum. This is called a type 2. If 2 wounds will be there, 2 ulcer will be there, type 2. Near antrum, type 3. Near cardia, type 4. Anywhere else, type 5. 5 types of gastric ulcer. This is a type 1. These 2 together, it is type 2. This one is type 3 ulcer, gastric ulcer. This is type 4. And this one is type 5. Type 5 is NSAID induced. NSAID induced. So type 5, you can easily treat. You can stop using NSAID. Remember here, out of 1, 2, 3, 4, in 2 types of gastric ulcer, there will be hypersecretion of hydrochloric acid. And in 2 types, there will be hyposecretion of hydrochloric acid. So wherever there will be hypersecretion of hydrochloric acid, so see, in the beginning, you have started what? So in the beginning, you have used some kind of medicine or like PPI only. Okay. But if patient is not responding to medicine, suppose the patient is not able to respond, now you have to go for surgical procedure. So one, you can do what? You can do vagotomy. You can do what? Vagotomy. Vagotomy. If you dissect the vagus nerve, it is not going to stimulate parietal cells, and there will be no stimulation. There will be no secretion of hydrochloric acid. Okay, fine. So vagotomy, when you are vagus nerve, when you are dissecting at the trunk, it is called a what? Truncal vagotomy. If you are dissecting vagus nerve here at the celiac part here, celiac plexus part here, this is called a selective vagotomy. But vagus nerve will be supplying like this also. Now let's see, inside like this, inside, no, inside, right? So these vagus nerve, if you are going to dissect with a specialized hand, separately, exclusively, so this will be called as what? Highly selective vagotomy. Remember, when I have done truncal vagotomy, yes, you can see here what? Maximum morbidity. Maximum morbidity, but less recurrence. Where you can see maximum recurrence, where you can see maximum recurrence, highly selective vagotomy. Highly selective vagotomy, maximum recurrence. Easy to understand. So we are not supposed to do only vagotomy. Where ulcer is there in the stomach, that portion we also have to remove, no? Right, no? So remember here, we have to do what? Gastrectomy with vagotomy. Gastrectomy with vagotomy. I hope you are able to understand this surgical part, this surgical correlation. So gastrectomy with vagotomy. So one function of vagus nerve you have understood here. One function of vagus nerve you have understood here, that this is going to stimulate parietal cells and there will be hyper secretion of hydrochloric acid. One more function of vagus nerve. This is giving what? This is having supply to this pylorus part also. Pylorus part also. Because of this only there is what? Motility. Motility. So when vagus nerve is not there, motility part of stomach is gone. Now whatever you are eating, that will get stored in a stomach only. That is not going down. That is not going down. That is not passing through duodenum part, because motility is not there, because vagus nerve you already have dissected. Fine, no? So when you already have dissected a small portion of stomach, no, gastric part, now you have to perform one more surgery. Either you are going to connect gastric part with a duodenum. This is called as gastroduodenostomy. 𝗵𝗺 1. 𝗵𝗺 1. Or suppose if you have removed most portion of the duodenum, so if you are anastomosing gastric part, stomach part with jejunum part, this is called as gastrojejunectomy. Gastrojejunectomy. This is called as 𝗵𝗺 2 surgery. Easy to understand, right? So when there will be hypomotility, when you have done only gastrectomy and vagotomy, no. So when there is no vagus nerve supply, there is no movement. I know. So remember, vagal stimulation will not cause the gallstone formation. Vagal inhibition will cause. Vagal inhibition will cause. Easy to understand, right? No, vagal inhibition will cause. Vagal stimulation is not the risk factor of gallstone. I hope with the help of this correlation, you can easily understand the topic and solve the question. Remember here, gastric mein peptic ulcer disease, most important. Gastric ulcer and duodenal ulcer, right? Vagotomy, gastrectomy, right now, 𝗵𝗺 1, 𝗵𝗺 2, very important. So when you have done gastroduodenostomy or jejunostomy, now, see, remember here, now the stomach is like this, right now? Because some portion you already have removed. Either you are going to anastomose with the duodenum or jejunum, right now. So either here or here, anastomosis. So now whatever you are eating the food, whatever you are swallowing the food, see, from stomach directly it is entering into the intestine very fast. You are not giving, your stomach is not giving that much time for the digestion. So sudden So sudden infusion of food into the intestine, that can cause secondary complication. That is called dumping syndrome. Dumping, if you remember, no, dumping syndrome, right? So dumping syndrome can be early dumping syndrome, and there can be late dumping syndrome. Early dumping syndrome within 30 minutes. Late dumping syndrome within 2 hours. Okay, so early dumping syndrome, sudden infusion of food, right? Now, because of that, there will be what? Hypersecretion of fluid. Now, remember here, there will be what? Loss of fluid, basically. So patient will be fainted because of what? So now here situation will be hypovolemia. Patient can go into hypovolemic shock. So how to treat early dumping syndrome? Fluids or IV fluid. But late dumping syndrome, hyperosmolar content, right now, that can release, remember here, that can release, like in the beginning, more glucose. So see here, physiologically, there will be what? More release of insulin now. Because of what? Hyperinsulin now there will be what? Sudden hypoglycemia. So there will be what? Right now, there will be what? Hypoglycemia. Patient can have symptoms of what? Hypoglycemia. And this is called as a reactive hypoglycemia. So how to treat? Oral glucose, sugar. In this manner, you can treat early dumping syndrome, late dumping syndrome. So I hope all these points are clear to everyone. 62 question, which type of incision should be given while operating on common bile duct? Very easy to understand. Answer, please. This is the liver. This is gallbladder. Right now? And this is your bile duct, common bile duct. Right now? So this is, remember, right hepatic duct, left hepatic duct. After that, common bile duct. Right? Okay. So suppose if there is stone in the biliary tract, which incision will you prefer? Remember basic anatomy, blood supply to hepatobiliary part here. No, this is in this fashion, longitudinal fashion, longitudinal fashion. So you cannot give incision like this. You cannot give incision like this because you can damage blood vessels. No, because you can damage blood vessels. So what kind of incision you should be giving? You have to give incision like this, longitudinal fashion, so that you should not be damaging blood vessel, right? So answer is what? B, longitudinal incision, right? A longitudinal incision, right? So what are the blood supply here? But mostly hepatobiliary. When I talk about biliary tract, no, mostly what? Arterial blood supplies, arterial blood supply is there, right? No, arterial blood supply. When I talk about liver, mostly venous is there. No, there portal vein will be there, right? No, portal vein. So which blood vessel especially we are talking about? What? Pancreatico-duodenal and gastroduodenal arteries. These are the blood vessels which are supplying here, right? Okay. A 55-year-old male presented with history of hematemesis. 450 ml of blood loss. Oh my God, this is very serious. Blood pressure is only 90/60. Pulse rate is 110 per minute. And splenomegaly. Splenomegaly. What is the most probable diagnosis? Can you answer me? What is the diagnosis? Can you answer me? Some of you might have marked duodenal ulcer, might be. Some of you might have marked gastritis. Some of you might have marked portal hypertension. Remember, this kind of question in surgery frequently examiners are giving. Okay. And remember here, when examiners will be framing the question, no, especially they will keep four options. Four options. Mallory-Weisstehr, Mallory, and 𝗵𝗵 syndrome, 𝗵𝗏 syndrome. And two other options like duodenal ulcer. Duodenal ulcer and portal hypertension. Portal hypertension. In all these four, yes, there can be severe bleeding. Chalo, we can discuss it because this is very, very important topic. Remember, see, surgical part of gastro GIT, peptic ulcer disease is very, very important. Peptic ulcer disease, where you'll be learning about gastric ulcer and duodenal ulcer. If examiner is asking where there can be massive bleeding will be seen in duodenal ulcer. Massive bleeding can be seen in duodenal ulcer because there can be perforation. Question is, at which portion of duodenum there will be perforation? Anterior, posterior? Posterior part. Okay, there will be severe bleeding because of which blood vessel? Gastroduodenal artery. Now tell me, if there is perforation in duodenal ulcer, which surgical repair you will be doing there? You have to keep a patch. Which patch? Modified Graham's patch, if you remember. Modified Graham's patch, right? Modified Graham's patch. Very, very important, right? Now, this patch repair should be done for duodenal ulcer. So there can be severe bleeding. Suppose if there is a question that one elderly patient is there who is already on PPI, who is a known case of peptic ulcer disease. He went to washroom and he had GI bleeding and severe, and suddenly he collapsed. Then answer will be what? Duodenal ulcer. In gastric ulcer also there will be bleeding, but less. Duodenal ulcer, massive bleeding can be there. More bleeding can be there. So now you can easily understand. Fine. Now how to differentiate Mallory-Weiss tear and 𝗵𝗏 syndrome? Very, very important. Mallory-Weiss tear and 𝗵𝗏 syndrome. Remember here, you can understand this topic with the help of this concept that there are two friends, A and B. Both are alcoholic, both went to pub, both had alcohol, and what happened? Both had hematemesis, both had blood vomiting. One patient, so after vomiting, one friend walked himself. He walked himself. He walked himself to hospital. But one friend, he collapsed. And other people have brought him to hospital. Remember, friend who walked himself is a case of Mallory-Weiss tear. Friend who got collapsed is 𝗵𝗏 syndrome. Why? Because when I talk about Mallory-Weiss tear, there will be only partial tear. There will be only partial tear of, see here, only partial tear of mucosal membrane here. Only superficial tear. Just below LES, at the cardia. Only partial, superficial. But when I talk about 𝗵𝗏 syndrome, remember here, at lower esophageal sphincter, there will be complete perforation. Complete perforation. Fine, no? Complete perforation. So severe bleeding. See, there will be this much perforation that, see, food particle alcohol that will enter the mediastinum, right? So severe mediastinitis. Remember here. So now in 𝗵𝗏 syndrome, there will be what? Retching, vomiting, severe pain, extreme pain, and severe pain, severe mediastinum. So severe pain will be there, severe pain in chest, you can say, right? No, and after that there will be what? Subcutaneous emphysema. Subcutaneous emphysema. This is making a triad. That is called a which triad? Mackler's triad. This is called as Mackler's triad, seen in 𝗵𝗏 syndrome. Remember here, most of the Mallory-Weiss tear you can improve. Most of the Mallory-Weiss tear, like suppose if you are admitting only with the basic management, 90% will improve. If some patients are not improving, still there is bleeding, you can do what? So after that, you can go for the embolization and all. You can go for the surgical repair, right? Last. But 𝗵𝗏 syndrome, surgery is mandatory. Surgery is mandatory. Open laparotomy. Surgery is mandatory. Within 24 hours, mortality rate will be less. But more than 24 hours, the mortality rate will be what? More than 50%. So now 𝗲𝗏 syndrome, you can easily understand, related to alcoholism and all. Portal hypertension. Remember here, portal hypertension means what? Portal hypertension means what? Right? Remember this part here. When I talk about portal part here, now how much is the normal portal pressure? Normal portal pressure is how much? 5 to 10 mmHg. It's normal. When there will be 10 to 12 mmHg, there will be formation of varices. So there can be variceal bleeding, right? Varices formation, right? Okay, fine. And more than 12 mmHg, now there will be rupture of varices. Varices means what? Varices means actually the tortuous veins where, see, suppose if this is the portal blood vessel and this is the systemic blood, when these are going to meet, this portion will be what? This portion will be called a what? Here there can be elasticity, right? No? Here there can be elasticity. And because of, if portal hypertension will be there, no, at this portion there can be the tortuosity of blood vessel. This is called as variceal formation. This is called as variceal formation. So because of portal hypertension, yes, there can be variceal bleeding. So when there will be portal hypertension, obviously you can see splenic vein, renal vein here, no? So remember here in portal hypertension, there will be what? Splenomegaly for sure, splenomegaly. So this is a case of portal hypertension. This is a case of portal hypertension. Bleeding can be seen in all. Portal hypertension also, right? 𝗲𝗏 syndrome, duodenal ulcer also, right? No, but splenomegaly, pakka portal. Fine, 𝗲𝗏 related to alcoholism, and you can understand the symptoms also. Duodenal ulcer, okay, old case, known case of peptic ulcer disease, right? Right now, and there can be massive bleeding. I hope all these points are clear to all of you. Now, what about this one? A 22-year-old boy, 60 kilogram, present with burns over his anterior part of thigh, right and left thighs, chest, abdomen, and right upper limb. Which of the following is incorrect related to the management of this patient? Can you answer me? Here, I'm sure you would have done the mistake. What is the answer you have given here? Answer, please. First of all, when you calculated total body surface area, how much it came? How much is the total body surface area you have calculated? I think you have calculated 45%, no? 45%, right? Because you have used what? Wallace rule of 9. Wallace rule of 9. Yes. Okay, fine. Chalo. Even if you are using Wallace rule of 9, so if you have calculated 45%, then it will be wrong. See, what is the Wallace rule of 9? 9%. See, when there will be burns across the body, 9% over upper lip, right upper, 9%, 9%, right? So I can make the diagram like this. Okay, see, this is the rule of 9. 9%, 9%. Head and neck, 9%. See here, anterior part of chest and posterior part of chest, 9, 9. Okay. So here you can say what? 9 plus 9. In the same manner, anterior part of abdomen, posterior part of abdomen, 9 plus 9. Now, when I talk about lower limb, 9 thigh, 9 leg. Okay. Head and neck, 9%. Genital organ will be, see, genital organ, 1%. Chalo, fine. So 9%, 9%. But remember here, it is especially mentioned here over his anterior part of right thigh, anterior part of left thighs. When I say chest, and I see here, chest, abdomen, and right upper limb. See here, chest, abdomen, 9 plus 9, right upper limb, also 9. But what about thighs? Where especially I have mentioned anterior part of right and left thighs. Only anterior, not posterior. 9% means complete thigh, circumferential thigh. So when I'm saying only anterior part, no, then this will be only 4.5%. Easy to understand. Remember like this. So this will be 4.5 plus 4.5. Then anterior part of chest and abdomen, 18%. Right upper limb, this is what? 36%. Now, your percentage will be coming only 36% and not 45%, which you would have done the mistake. So answer is only 36% here. Now, how much fluid should be given? Right now, so how much fluid should be given? So you have a Parkland's formula right now, 4 into percentage of bone into weight of the patient, right? So this will be coming approximately 8.64 liter. So half of the calculated fluid should be given in first 8 hours, half next 16 hours. Even on day 2 also, half of the calculated fluid should be given. Remember it. So here, half of the calculated fluid will be how much? 4.32. Okay, no? So remember, even on day 2 also, you have to give what? 4.3 liter on day 2, complete 24 hours. Admission is required or not? Yes, 36% burn. Hai? Remember, 36% burn, for sure you have to admit the patient. Right now, how to treat? Fluid therapy, analgesic, antibiotics, and yes. Remember here, option C is wrong. Option C is wrong. Why C is wrong? 5.4 liter is not given in the first 8 hours. Okay, no, 4.3 liter, 4.3 liter. Okay, no, so if you do not calculate total body surface area in appropriate manner, then your answer will be wrong. Very easy to understand. In this manner, examiners are playing with the knowledge. Answer is C. Next. You're working as a duty doctor in emergency department. One unresponsive patient is brought to you by the police. What is the first thing you will do? What is the first thing you will do? Huh? So suddenly you are going to start CPR. First of all, check whether he is alive or not. First of all, check for the carotid pulse. Check whether he is alive or not. Answer is C. This was asked in AIMS previously. Now, a 26-year-old female presented to emergency department with multiple abrasions. Injuries over the right forearm due to broken bangles. This is very common in India, broken bangles. What are the appropriate steps in management? Answer, please. All of you, please answer this question. Okay, chalo, fine. Some of you might have marked option D. Some of you might have marked option A. I think some of you might have admitted her also. See, remember here, multiple abrasion with broken bangles. Broken bangle, yes, this can happen. Even superficially, if you are not able to see any broken bangles, no. But remember here, there is very high risk that broken bangles can get deposited subcutaneously under the skin also, right? No, so that will be a foreign object, no, and that can lead to serious, serious problem to the patient, right? No, so anytime, always remember that, see, bangles are made up of what? So glass or lead that can appear on X-ray. So whenever you suspect any foreign object accumulation in the body, okay, now under the skin, please, first of all, do X-ray. Get X-ray done. First of all, get X-ray done. First of all, rule out if there is no any accumulation of broken bangles. First of all, rule out. X-ray is mandatory first. After that, suppose if there will be accumulation, minor surgery if needed. Otherwise, no, then antiseptic dressing, analgesic, and antibiotic. So answer is C. A 14-year-old boy presented to emergency room with a history of fall from second floor. After falling from height, he felt nauseating for 2 times, but did not lose his consciousness. On examination, his vitals are stable. No other injuries were found over his body. He is talking normally. What should be the next line of management? Answer, please. See, this kind of questions are being framed in general part of surgery. Answer, please. So basically, CT scan should be done or not. You have to take a decision. Okay, history of fall. So what are the indications of CT scan? What are the indications of CT scan? You ask the patient after fall, was there loss of consciousness? See, after fall, did you lose the consciousness? Yes or no? If history is yes, CT scan is mandatory. You ask him, did you get seizure or convulsion? Seizure or convulsion after fall? After that, nausea or vomiting for more than 1 time. Nausea or vomiting. Because CTG center, that is nearest to respiratory center. Right? So that can be very much dangerous if there is any history of nausea and vomiting. 4th point, if you see Glasgow coma scale, if it is less than 13. 5th point, if you see open fracture. See here, if these are there, no, then a CT scan should be done. Remember here, so in this case, he had nausea. He had nausea for 2 times. No, nausea for 2 times. Although he did not get any other injuries, but please, nausea is there. Please rule out. Please check is his respiratory center is safe or not, because nearest to that CTZ center, no, CTZ center that is responsible for nausea, vomiting, right? Or nausea, vomiting. So yes, get NCCT done. After that, rule out the injuries. So answer is C. Next question. Yes, this question is 𝗲𝗄𝗃 question, OG question, 𝗲𝗃. A young female is presented with the complaints of primary amenorrhea. On examination, normal breast development with absence of axillary hairs are found. On pelvic examination, there is normally developed vagina with clitoromegaly. On ultrasound, gonads are visible in the inguinal region. Oh my God. What it is called as, right? This is called as what? This is a case of androgen insensitivity syndrome. Androgen insensitivity syndrome. Old name, testicular feminization. So basically other name is what? Testicular feminization. Where, see here, this is all about what? Androgen. So here, you can say, okay, this is a case of what? Androgen insensitivity syndrome. But is it complete or partial? This is the question. But yeah, genetically, there will be what? 48. See here, Genetically, there will be what? 46XY. But physically female, pseudo hermaphrodite, physically female. If person has become complete female, 100% female, no, then it will be called as a case of complete androgen insensitivity. No, complete, right? No, complete androgen, right? No, means 100% female. But here 𝗙𝗵𝗃𝗃, no, 𝗙𝗵𝗃𝗃. Remember here 𝗙𝗵𝗃𝗃, right? Right? 𝗙𝗵𝗃𝗃 means what? Now, this will appear to be like a small penis. This will appear to be like a small penis, right? Or a small penis. So remember here, this is a case of incomplete. This is a case of what? Partial androgen insensitivity syndrome. Answer is D. Answer is D. Partial androgen insensitivity syndrome. Easy to understand? Answer is D here. Answer is D. Right? Please remember here that how to differentiate complete and partial. Complete means what? 46XY. Right now? But complete means what? Complete, she will appear to be like complete female. Hai na? Complete female. So she will be treated as female only. But when I talk about partial, no, there you can see 𝗙𝗵𝗃𝗃, that will appear to be like a small penis. No, a small penis, right? Very easy to understand. That is called what? Virilized female. That is partial androgen insensitivity syndrome. So here answer is what? Partial, not the complete. Okay. Remember, see in 𝗲𝗵𝗃𝗃, Mullerian agenesis, MRKH syndrome, Turner syndrome, gonadal dysgenesis, Noonan syndrome, AIS, androgen insensitivity syndrome. These are very, very important topics, and please do good revision in these topics. Next question. A 50-year-old patient presented to you with ongoing massive hematemesis. The patient is alert and hemodynamically stable. Hemodynamically stable. Stable. Patient is having what? Bleeding, but now patient looks stable. So what will be the first step in management? Here also some of you would have done mistake. What is the answer? What is the catchy point? Ongoing massive bleeding. Ongoing bleeding is going on. Although patient looks stable now, what will happen after 2 minutes? You never know. So first of all, put the patient in a recovery position and secure airway. Answer is C. Always remember first airway, then breathing, then circulation. Important. Please remember this. ABC, very, very important, right? No, so always secure airway, because suppose if there will be loss of blood, you will have some time to help the patient. But if there will be a stoppage of airway, on the spot, shut down. Easy to understand. So answer is C. Next question. Yes, this is a case in appendicitis. Appendicitis. Which sign? Remember here, appendicitis, very, very important topic for exam. There will be no FMGE exam without a question from appendicitis. One question will be there for sure. One question, appendicitis. So first of all, suppose if you are going to palpate over left iliac fossa, and after the patient is having pain in right fossa, this is called as a 𝗏𝗏𝗃 sign. This is most pathognomic. 𝗏𝗏𝗃 sign. When you are palpating over the left side, patient is having pain on the right side. That is called as 𝗏𝗏𝗃 sign. Okay. But when you are going to move like this, when you are asking the patient to move the leg like this, patient will be having pain. This is called a what? Which muscle will be here? 𝗏𝗏𝗃𝗃 sign. Right now, this is called a what? 𝗏𝗏𝗃𝗃 sign. Right now, 𝗏𝗏𝗃𝗃 sign. Okay, 𝗏𝗏𝗃𝗃 sign. Remember, some other signs are also there. Suppose if patient is in supine position and you are asking him to pull the leg back, pull the knee back, and after that, if you are going to medially rotate the leg, right now, so that is called what? Obturator sign. If you pull right spermatic cord gently, there will be pain. That is called a 10-horn sign. If you ask the patient to cough, patient is having pain. That is called a 𝗏𝗏𝗃𝗃 sign. 𝗏𝗏𝗃𝗃𝗃 sign. Right? There can be rebound tenderness. There can be McBurney sign. All these are important to appendicitis. Okay, related to appendicitis, very important question every time they are asking. Suppose if I ask you one question, okay, I'm giving you a clinical scenario. You tell me your answer. What is your answer? You are working in emergency department, surgery emergency department. Suddenly you got one young patient with severe abdominal pain in the right lower quadrant. Okay, on the as per the clinical examination and ultrasound examination, you found this is a case of appendicitis. You found this is a case of what? Appendicitis. You found this is a case of what? Appendicitis. Okay, fine. Now, when you have shifted the patient to operation theater after anesthesia, surgeon is supposed to palpate it again, right hypochondrium, right? No, so surgeon is supposed to palpate it again. When surgeon is palpating, no, surgeon has found one mass. Now, what will you do? Are you going to continue this surgery? Or you are going to cancel the surgery? What is the answer? Basically, I have given you a case of appendicitis. Okay, after anesthesia, when you are palpating again, you are finding one mass in right hypochondrium lower side. Okay, fine. You are finding a mass on palpation. My question is that, are you going to continue this surgery? You are going to remove the appendix, or you are going to abort this surgery? You are going to cancel this surgery? What will you do? Can you answer me now? Please write down in chat box. All of you. What will you do? Yes, you are going to cancel the surgery, abort the surgery. What it is called as now? Abort the surgery, cancel the surgery, go for CT scan, CT scan, because this is a case of what? Appendicular perforation now, perforation. Remember, this is a case of appendicular mass. Already perforation has happened, so cancel the surgery, check on the CT scan, right now. And now you start the patient on conservative management. Conservative management. Please start the patient on conservative management. What is the name of that conservative management? Repeatedly asked question. Can you write down in chat box? What is the name of conservative management? Where you have to start the patient on high dose antibiotics, IV fluid, and monitor vitals like pulse rate, respiratory rate, blood pressure, monitor it, right? Fine. Temperature. What is the name of this conservative management? Can you write down in chat box? It is called as what? Ochsner-Sherren regimen. Ochsner-Sherren regimen. Very, very important. Ochsner-Sherren. This is not medicine. This is just the conservative management in a case of appendicular mass. Remember, this is for appendicular mass, not for appendicitis. This is for appendicular mass. This is just the conservative management. Many patients will improve on IV fluid, high dose antibiotics. Okay, fine. With analgesics also, obviously. Right now, monitor vitals. If vitals are improving, then no need of surgery. If vitals are not improving, then you have to operate as soon as possible, right? I hope all these points are clear to all of you. After removal of appendix, the stump will be ligated. With which suture? Which type of suturing you are doing after appendectomy? Which type of suturing? Something like this. What is this? Name of suturing, it is called a purse string suturing. Purse string suturing. Important question for MCI. Surgery question, appendicitis is always important. Next question. During lactation, main hormone responsible for initiation of milk secretion. Can you answer me? Oxytocin, prolactin, both, right now? But especially for initiation, it is being asked. Initiation of milk secretion, prolactin. Answer is C, prolactin. Remember here, initiation by prolactin, ejection of milk by oxytocin, maintenance of lactation by prolactin. Right now? Fine. And for the development of breast, yes, estrogen and progesterone, these are responsible. right? So this was actually very easy question for you, but I am sure some of you would have done mistake because there will be confusion in prolactin and oxytocin for sure. What is the name of this triangle? Here I have given you so much hint. Here I have given you so much hint, right? Tumor arising from gastrin secreting G cells. G cells. Basically, I'm talking about gastrinoma. Which triangle? Passaro's triangle. Passaro's triangle. Passaro. Some of you might have marked option A because you were thinking that this is a Ewald's triangle. No? Suppose if I would have highlighted here, no. Suppose if I would have highlighted here, yes, then this was actually the Ewald's triangle or hepatocystic, right? No, but this is what? Passaro's triangle for gastrinoma. Triangle of Koch, that will be in the right atrium part of the heart side, okay? Heart. So this is called as what? So remember here, this is called as what? Passaro's triangle, from where most of the gastrinoma, right? So gastrinoma will be starting from here only. This is Passaro's triangle. What about this one? A 35-year-old lady presents with fatigue, tingling sensation in both hands and legs. On examination, she is found to have following presentation as shown below. See around the lips. Around the lips. Look at the red color of tongue. Look at the eyes. Okay, na cheilitis and all, stomatitis, if you remember, due to deficiency of which vitamin? Riboflavin. This is actually biochemistry question. Riboflavin, no? Vitamin B2. Vitamin B2. Answer is vitamin B2. Riboflavin deficiency. Remember here, riboflavin deficiency. There will be what? Glossitis, chelosis, right? No, there can be itching and the burning sensation in the eyes, right? So remember here, around this area, you can remember, what? Vitamin B2, riboflavin. Bleeding from the gums and nose, vitamin C, right? Vitamin C. If a patient is already on TB drug like ATT, TB drug, already on TB drug, which vitamin deficiency can be seen? Vitamin B6, pyridoxine. Okay, remember all this. Alcoholic patient, which vitamin deficiency? Vitamin B1, thiamine. Due to deficiency of vitamin B1, which neurological disease can happen to the patient? Can you tell me? Yes, Wernicke's encephalopathy and Korsakoff syndrome. Korsakoff syndrome. You would have learned in psychiatry. Wernicke's encephalopathy, which is acute. What will be the symptoms? Global confusion, ophthalmoplegia, horizontal nystagmus, and ataxia, Goa. Involvement of especially which cranial nerve? Sixth cranial nerve. This is Wernicke's encephalopathy. Remember, Wernicke's encephalopathy is very, very important question. Wernicke's encephalopathy. Okay, this is acute condition. How to treat? Injection of vitamin B1 as soon as possible. Korsakoff, long term. There you can see confabulation, making false stories to fill the memory gap. All these are related to vitamin B1 deficiency, vitamin B1. Remember, alcoholic patient is there, thiamine deficiency, B1 deficiency, you have to keep in mind. Okay, all right. Next question. So this question is related to ophthalmology. A 30-year-old male presents to clinic with complaints of pain and watering in the right eye for 36 hours. On examination, a 3 × 2 centimeter corneal ulcer is seen with elevated margins, feathery hyphae, finger-like projections, and minimal hypopyon in cornea. So, which infection is this in the eyes? This is an infection of what? Fungal infection, no? Fungal infection, right? So out of these four, aspergillosis, right? C, aspergillosis. Remember here, fungal corneal infection. So answer will be what? Aspergillosis. This is very Easy question for you. Clinical question, very easy. In a case of upper motor neuron lesion, right? No, you upper motor neuron lesion. This sign will be, and I say this sign will be seen, right? Now, what is the name of this sign? This is 𝗵𝗵𝗀𝗃 sign only, no? 𝗵𝗵𝗀𝗃 sign, right? 𝗵𝗵𝗀𝗃 sign. Remember, this is a very easy question. 𝗵𝗵𝗀𝗃 sign, right? A child presented with OPD with unilateral nasal block. And epistaxis means what? Epistaxis, nose bleeding. So this is a question from ENT. Child, nasal block and nose bleeding also. When I talk about a child, most of the time there can be accumulation of what? Can you answer me this question? Foreign body. Foreign body, right? No? Foreign body. This is the answer here, foreign body. Next question. A neonate presented with jaundice on day 1 of life. First day. His mother blood group is O positive. So RH compatibility can be ruled out. RH incompatibility. How will you manage day 1 pe? Physiological jaundice will take some time, right? No, I'm talking about a day 1. So there will be some pathology. How to help? Please do some. And so on day 1, what to do here? How to help? Phototherapy. This is a question from pediatrics. Phototherapy, no? Phototherapy. Remember? Phototherapy. So you always remember that day 1 pe, if there is jaundice, no, day 1 pe, right? No, so mostly there can be some problem, no, some pathology will be there for sure, like hemolytic problem hai, there can be infections, very easy to understand. So that should be treated as soon as possible with the help of what? Phototherapy. Phototherapy. Mother group, see here, mother blood group is O positive here. So yes, RH incompatibility, you can rule out. Very easy to understand, no? Fine. Answer, please. This is also ophthalmology question. Ophtha question, right? And this is also ophthalmology question. A child 10 years of age complains of burning, itchy sensation in the eye, recurrent condition in spring and summer. Maxwell-Lyon sign. Remember, very, very easy. Spring catarrh, right? No, vernal conjunctivitis. Right? Very easy question. No? Vernal conjunctivitis also called as what? Spring catarrh, right? Or spring catarrh, right? No, very easy to understand. So see here, what kind of presentation will be there? See here, sometimes you can see what? Cobblestone appearance or pavement stone appearance, Maxwell-Lyon sign, white ropey discharge in the eyes, right? Very easy to understand. Remember, we can also see Horner-Tranter spots. All these are repeatedly asked question in vernal keratoconjunctivitis, right? Now, vernal conjunctivitis also called as a spring catarrh, especially in the young boys, especially in the spring season. All these are important, no? All these are important. All these are repeatedly asked question in MCI. So answer is vernal conjunctivitis. Next question. This is a question from dermatology, derma. 7-year-old child complains of intense itching that gets worse at night. On examination, there is presence of thin burrow line. This is the catchy point, burrow line, ending with pustule on the skin. His younger brother also has the similar curve. This is very infectious. Burrow line, where do you see? Burrow line. Very easy question. No? This is a dermatology question. Very infectious. Not maintaining hygiene and all, right? Scabies only, right? Scabies. Scabies, how to treat 5% permethrin. You would have heard about this, right? Now, remember here, scabies is an important topic in derma. Okay, no? So what is the pathognomic finding? Burrow line. All right. Next question. A patient 65 years of age suffering from CML was prescribed with hydroxyurea. During period of time, there is a dusky red and itchy rash on face and eyelids were seen. On examination, Gottron sign and a Scholl sign. Actually, this is a direct question. Where do you see Gottron sign? Where do you see Scholl sign? This is a case of what? Inflammatory myopathy, basically, right? This is the question of dermatology also, like you can say rheumatology also, medicine. Red sign, purple sign around the knuckles, this is called a Gautrans. Around eyelids, it is called a heliotropic rash. Around the shoulder, like this, it is called a shawl sign. Shawl. Right now, around the thighs, holster sign. These are seen in dermatomyositis. Dermatomyositis. Remember here, very, very important question. Dermatomyositis. Remember, heliotropic rash, eyelids, Gautrans papules. Right now, easy to understand. Hands, holster sign over thighs, shawl sign around the shoulder, dermatomyositis. Dermatomyositis. Okay, this can also be because of some drugs like hydroxyurea, okay, no, D-penicillamine and phenytoin. Basically, these drugs will exaggerate it, right? These drugs will be exaggerating. So there will be what? Skin rashes, okay, something like a reddish or purplish color. So these are the changes in dermatomyositis. Next, medicine, okay. A woman 45-year-old is suffering from sudden severe attack of pain, swelling, redness, and tenderness in the joints, often the joint at the base of big toe. Patient complain of severe pain after consumption of alcohol or meat-rich diet, basically talking about protein diet. Because of that, blood test is suggesting what? Hyperuricemia, pain over the joints, especially big toe is involved. Hyperuricemia. Where do you see? Gout. It is seen in gout. Right now? Gout. I hope all these points are clear to all of you. Gout. A 27-year of age attend a breast screening test camp. On examination, there was a mobile, palpable breast lump, which was painless at upper outer quadrant. What is your diagnosis? Easy question. Something like mouse, movable, painless, fibroadenoma, no? Fibroadenoma, right? Fibroadenoma. Next, obs gynae question. A 31 weeks period of gestation presents with pain in lower abdomen. The clinician is worried if the patient is in preterm labor. Preterm labor. What is the test she should be getting done now? What is the indication of preterm labor? See, in this cervicovaginal secretion, what will be there? If there is preterm labor, no, if there is preterm labor in cervicovaginal secretion, there will be what? Fetal fibronectin. Fetal fibronectin. Remember, very easy question, and this is repeatedly asked question. Out of these four, fetal fibronectin test should be done. If it is there, see, you know, so suppose if it is there, no, so what does it mean? Already there is what? Rupture of membrane. So this indicates what? Preterm labor. Deficiency of which of the following can cause the type of nails as shown in photograph? Very easy for you. Answer, please. What do you see in this photo, first of all? Which type of nail? Which type of nail? Spoon-shaped nail. Spoon-shaped nail. Where do you see a spoon-shaped nail? Basically, spoon-shaped nails is called as a 𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 of iron. When there will be deficiency of iron. Answer is C. Answer is C. I hope you would have learned about, see here, I would have learned, like you would have learned about pickle. See, even in medicine also we have pickle. What is the meaning of pickle? Where do you use pickle? Answer me, please. When you do examination to any patient, no, when you do examination to any patient, first of all, P for you check whether patient looks pale or if there is a pallor. If patient looks pale, which blood investigation to be done now? First of all, you write the full form. P for pallor, I for icterus, C for cyanosis or clubbing. Okay. K for 𝗂𝗁𝗃𝗃. K for 𝗂𝗁𝗃𝗃. Okay. L for lymphadenopathy. E for edema. Please write down, very, very important this is. So see, to understand, yeah, what is this pickle here? Why we have to see this? We have to check the patient. If you can see patient face, if patient appears to be pale yellow, then which blood investigation is mandatory? CBC with hemoglobin. If eyes are also yellow, means icterus, it means jaundice, so liver function test is mandatory. If you see cyanosis means a bluish discoloration, peripheral, central, around the face, around the nail, cyanosis, no, cyanosis, then please check. So it means saturation of oxygen. You do SpO2, you check SpO2, you do ABG also, ABG. If clubbing is there, what is the meaning of clubbing? Ask the patient to club fingers like this. If you can see a gap, it's normal. If you cannot see a gap, it means what? Clubbing of fingers. This is called a which sign? Shamroth's window test. No, Shamroth's window test, right? This will be positive whenever there will be pathology in heart and lungs, right? No, when there is what? Obstruction, or when there is any pathology which is going to cause what? So less supply of the blood. Heart and lungs pathology, please check this. Please check this, right now. So if you see this, then ECG is also mandatory. X-ray of chest is also mandatory, right? 𝗂𝗁𝗃𝗃, spoon-shaped nail. So you have to check what? Iron profile. If a 40-year-old female is complaining of 𝗂𝗁𝗃𝗃, iron deficiency anemia, and dysphagia. What does it mean? Where do you see 𝗂𝗁𝗃𝗃, iron deficiency anemia, dysphagia? Where do you see? Plummer-Vinson syndrome, surgery, Plummer-Vinson syndrome, also called as Kelly-Patterson syndrome. Remember, very, very important. Lymphadenopathy, if you can see any kind of lymphadenopathy here, axillary, inguinal, means anywhere, right? No, so lymphadenopathy might be HIV, might be any tumor, right? No, HIV and might be any tumor. Edema, then especially albumin. And go for KFT also. See here, on the basis of this physical examination, only we have learned what are the blood investigations which can be done. Very easy to understand. So now you will be having so many information about the patient. Easy to understand, right? So remember here, if you see spoon-shaped nail, iron profile to be checked. Next question, obs-gynae question. A 50-year-old post-menopausal lady presents to OPD with 2 episodes of post-menopausal bleeding. What is the first line of management? I think some of you would have marked biopsy. I think so. What is the answer? Do understand the language of examiner. Dekho, patient is 54-year-old after menopause, right? She is having the history of 2 times post-menopausal bleeding. First of all, you check, you start with the non-invasive procedure. No, you do ultrasonography, non-invasive. First of all, you check why, where, how. So first of all, do what? Least invasive, non-invasive. No. So first of all, transvaginal ultrasound. First line of management is what? TVS, transvaginal ultrasonography, right? Transvaginal ultrasonography. Remember, understand the language of the question. Okay, don't mark directly biopsy. Okay. Next question. This is also 𝗲𝗄𝗃. A female 38-year-old. She comes to clinic for antenatal scan at 12 weeks of pregnancy. The scan reveals more than 3.5 nuchal translucency. Nuchal, all right. Ultrasound reveals non-ossified nasal bone. And the condition is predicted to cause a dementia at a much earlier age. We can easily understand now. I have taught you in psychiatry also. You would have learned in medicine also, neuromedicine also. And in 𝗲𝗃, we are solving the question now. Remember here, if I talk about, see here, this one, nuchal translucency, non-ossified nasal bones, right now? This is a case of what? Yes, Down syndrome, Down syndrome. Down syndrome only, no? Down syndrome. Remember here, when I talk about dementia, dementia is common. Dementia will be seen only in old age. Only in old age. After 65 years of age, 5% risk. So as per the age, there will be higher risk. Remember here, but only in one condition, only in Down syndrome. If a person is suffering from Down syndrome, dementia can start at a much earlier age. Dementia can start at 35 age also. Very easy to understand. Here answer is Down's syndrome. Down's syndrome. See this question. A 40-year-old female complains of post-coital bleed. This is also 𝗲𝗃 question. No growth is seen on a speculum examination. Per speculum examination is already done where there is no growth. Where there is no growth. But she's complaining of what? After sexual intercourse, she is having bleeding. What do you suspect? Post-coital bleed. What do you suspect mostly? Mostly, you suspect cervical cancer. You suspect cervical cancer. See, per speculum examination is already done, right now? So now, what is the next line of management? Now you should do biopsy, right? Because you are suspecting what? Cervical cancer. So colposcopy and biopsy. Colposcopy and biopsy. Easy to understand. In this manner, you have to see the question, right now? In this manner, you have to see the question and you have to mark the answer. You might have marked Pap smear. That is just for the screening, right now. Here already you have seen the signs here. No, and speculum examination is already done here. No growth was there. So go for biopsy then, right now. Go for biopsy then, right? Okay, fine. Fine now. Means what is happening here? When Pap smear will be negative, no? When Pap smear will be negative, then only we are doing per speculum examination, right now. So and after that, suppose on per speculum examination, if you see anything, then you can take the punch biopsy and all, right now. You can take the punch biopsy. Suppose even if the punch biopsy is also negative, then you are going for what? Colposcopy, right now. Fine. So even on the colposcopy, if you do not see anything, then last option is what? Biopsy. Biopsy. And even after that also, if you do not see anything, then go for conization. So now you can easily rule out. I'm sure you would have learned all these in 𝗲𝗃, right? 𝗲𝗃 faculty would have taught you all these in detail. Which of the following vaccines is not to be frozen? So this is PSM question, but I think this question was not given in your exam today. Remember here, the questions which I'm discussing, I think I have got extra 5 questions. Okay. In examination, you would have solved only 150 questions. Okay, no problem at all. 5 questions extra you will see here. Okay, fine. 5 extra questions you will see here. Answer is DPT. Diphtheria, pertussis, tetanus. Next. This is PSM question. This is PSM. A study was done in 3 states to see the mean blood pressure in each community. Health workers are assigned and they visited each house in the 3 communities. Mean blood pressure in each community was found and compared. What type of study design is this? This is actually what very, like short form, fast way of doing examination, a kind of research. See here, basically, we wanted to talk about 3 states, but we have done what? Mean blood pressure. What we have done here? Only cross section of the society we have taken here. This is a type of what? Out of these 4 option, answer is what? This is a type of cross-sectional study. Cross-sectional study, which you would have learned in PSM, cross-sectional study. What is this basically? Simple form. Dekho. Single examination on a cross-section of population at one point. Okay, no? At one point of the time. That's it. Fine, very easy to understand. So basically, this is simplest form of observational study, and this will indicate what? Incidence or the prevalence. This will indicate prevalence. This will give you information about prevalence, right? Now, prevalence. So remember here, answer is what? Cross-sectional study. Answer is D. This is medicine question. You can see here, as per the photo, you can easily understand where do we see these signs. See, if you are going to tap here, then there'll be the twitching, no? And after that, if you are going to apply, if you are going to increase the pressure of BP curve, so hand will become like this. Where you have seen, where? Very important, hypocalcemia. What is the name of sign? This is called a chopstick sign. This is known as 𝗏 sign. Remember, these are important tests for hypocalcemia. Deficiency of calcium, chopstick and 𝗏 sign. This is very easy image-based question. First year anatomy, or you can say histology. Basically, blood cells. First of all, tell me which blood cell is highlighted here. You can see multiple lobes here, 3 lobes here. So this is nothing but a neutrophil. Neutrophil. So which of the following is the right? D. It acts as a phagocyte. Right now, phagocytes. See, in the first 24 hours, which blood cell will increase to fight against any infection, any allergen? Neutrophils. After 24 hours to 72, there will be what? Monocytes, right? Remember, all these are very, very important, right? You should know about the blood cells also. Now, this is the favorite topic. Remember, still we are in the COVID time. You can say still we are. I think you can say like that. I know. So dekho, COVID-19, huge disaster. One question from COVID-19 will be there for sure. Maybe what is the name of that test? Okay, nasopharyngeal swab test. Maybe about a virus like this, the way I have asked you a question in microbiology and medicine here. Maybe about the vaccines, right? A name of vaccines, post-COVID complications, right? Now, post-COVID complications. So don't forget to revise about COVID-19. Right now, COVID-19, very, very important. Fine now, see, there will be what? Fever, there will be dry cough, there can be shortness of breath, there can be anosmia, dysgeusia, right now. And after that, after 1 month or 2 months of treatment also, there can be pulmonary fibrosis, right? Also, there can be blood-related problem, right? There can be DVT also. So basically, whatever, see, because COVID-19 can be integrated with all these subjects. ENT also, mucormycosis, right now. Pharmacology also, right? Okay, how much of steroids we have used, okay? Which drugs we have used, right now? All vaccines can come there. Fine. ENT means surgery for mucormycosis, plastic surgery also. Right now, very easy to understand. Right now, so what are the drugs? How much was the dose? Which antibiotic we have used? Why azithro was given? Why montelukast was given? Easy to understand, right? So COVID-19 is very, very important. To how to wash hands, they will ask. They can ask for how much duration we have to, like sterilize for the 20 seconds, right? Easy to understand? Right. So which of the following is wrong about this virus? It is enveloped. Okay. Remember. Next question. Pattern of skin rash in a case of viral disease is shown here. Lesion in various stages of evolution, such as maculopapules. Okay. vesicles, pustules, scabs are seen in one area at the same time. Basically, this is a case of chicken pox. Chicken pox, very common. You would have heard about chicken pox. So what is the causative agent here? What is the causative agent? Varicella zoster virus, right? Related to Epstein-Barr virus, related to 𝗬𝗵𝗏𝗴𝗺, 𝗬𝗵𝗏𝗴𝗺 owl eye sign was there. Epstein-Barr virus, this can cause what? Nasopharyngeal carcinoma also. Burkitt's lymphoma. Remember here, how they are going to integrate microbiology, Epstein-Barr virus with medicine and pathology. This can cause Burkitt's lymphoma. You would have seen a photo of African child who is having a swelling in the jaw, Burkitt's lymphoma. Which CD marker? CD21. If you are able to recall all these are important, right? Remember here. So like you would have seen all these in your microbiology as per the pattern of rashes right now. See here, as per the pattern of rashes in shingles and chickenpox. Next question. A young patient complains of abdominal pain, joint pains, and on examination palpable purpura. This is a common trait: abdominal pain, joint pain, purpura. Where do you see? Even IgA deposits are also seen. Where do you see? Enoch-Schonlein purpura, HSP, right? Enoch-Schonlein purpura, HSP. C answer. Next question. Obs-Gynae and pharmacology. A 24-year-old female taking anti-epileptic drugs, anti-epileptics for a seizure disorder. She gets married. When should folic acid supplementation advised to the patient? Here you have to take the decision. Remember, if she is already on anti-epileptic, no, folic acid 4 milligram or 400 microgram, it should be started as soon as possible. Okay, no? Irrespective of the pregnancy. When she got married, no, remember here, it should be started as soon as possible. As soon as possible. Answer is D. Anytime as soon as she presents to the clinic, irrespective of the pregnancy. Because there is what? Very, very high risk of neural tube defect like spina bifida. High risk, fine, no? So folic acid can support the patient, right? This question is very, very easy. I think easiest for you. You can see here, there is a karyotype. You can see there is what? There is trisomy in chromosome number 30. Which syndrome? Patau syndrome, Patau. Edward syndrome, engagement time 18 year. Down syndrome, 21 year. Remember like this, trisomy. Next question. See, after looking at the picture only, you can understand, no? That everything is long, person is tall. A person is suffering from an autosomal dominant disease. Okay? Long limbs, long digits. Due to mutation in which gene? Fibrillin. What else you want? Fibrillin gene mutation. What it can cause? It can cause Marfan syndrome. Which gene? So which chromosome here? 15th chromosome. 15th. But short arm or long? Everything is long arm. Right now, 15 chromosome, 15q. Remember 15q. See, when I write P or Q, P pediatric, so short arm of chromosome. Q means what? Long arm. Remember like this. This is PSM question. PSM question related to public health importance. So which day is being celebrated as? So first of all, tell me what is this? Sign, symbol, please. HIV. No, this is what? HIV. HIV, 1st December. 1st December, right now? 1st December. HIV, 1st December. Doctor's Day, 1st July. See, in PSM, you have to memorize all these. Now, what about this one? I'm sure some of you might have marked Geneva, Switzerland. Geneva belongs to WHO. Means WHO center is there in Geneva. This is what? This symbol. See, there is a child. This is a UNICEF program. UNICEF. This is UNICEF. Where is the headquarters? New York. New York, USA. Answer is A, not the B. Pneumoconiosis. See, when I talk about occupational lung disease, no, occupational lung disease. Occupational lung disease, right? So when a person is working in coal industry, anthracosis, dust industry, or you can say cement, silicosis, asbestos, asbestosis, cotton dust, bicyanosis, but here sugarcane, no, bagasosis. Please remember, say this kind of question repeatedly they are asking in PSM. Very, very repeated. We're going to repeatedly ask question. Out of these pneumoconiosis, occupational lung disease, which lung disease is mimicking like tuberculosis? Which lung disease is mimicking like tuberculosis? Silicosis. Okay, silicosis. Now, out of these occupational lung diseases, which one can cause lung cancer? Lung cancer. Remember here, asbestosis. Asbestosis. Which lung cancer especially? Name bolo. Mesothelioma. Mesothelioma. All these are important. Next, PSM question. Which mosquito is this? First of all, this white strip, right? This is Aedes aegypti. This is what? Aedes aegypti. Aedes aegypti, Aedes, which can cause a dengue, which can cause what? Yellow fever, right? Yellow fever. Some other, remember here, yellow fever, dengue, chikungunya, Zika fever, all these are transmitted by Aedes aegypti. Look at these two. When it is at the, see this one, Anopheles, which will cause malaria. This is a Culex. This mosquito is Culex. Remember, you have to see and recognize the picture of mosquitoes also. Then only you can diagnose the disease which are being transmitted by these mosquitoes. Remember here. So yellow fever and dengue, classically you have to remember. Okay, yellow fever and dengue. Okay, see this is being transmitted by Aedes. But what about Culex? It transmits Japanese encephalitis, filariasis, right now? Right now, so all these are very, very important to memorize. This is also PSM question. Which of the following vaccines is given through this route? Basically, which route is this? This is intradermal, no? Intradermal. BCG, right now? BCG vaccine. Now, this is also PSM question. Which of the following is the best study to assess in quick time the strength of association between smoking and lung cancer? Smoking and lung cancer. PSM question. See, now you have to understand the association between a lung cancer and smoking. No, so you have to go back. Right now, you have to do what? Retrospective studies. You have to do what? Retrospective. Right now, one is called prospective, since beginning to last. Last to beginning, when you have to come back, right now, that is called a case control study. Case control study. That is retrospective manner. Retrospective manner. Right? Ops-gynae question. A 21-year-old 𝗵𝗵 admitted at 39 weeks of gestation with a painless antepartum hemorrhage. On examination, uterus is soft, non-tender, and head is engaged. Head is engaged. What is the next line of management? See here, just before delivery, bleeding is already started. Bleeding is already started right now. Head is already engaged. So this is a case of what? Antepartum, not postpartum. Postpartum is what? After delivery. This is antepartum. No? So what is the first line of, see, what is the next line of management here? First of all, do ultrasound, check it, check the level, and perform immediate delivery. First, ultrasound, and do what? Immediate delivery. What is the treatment of choice for antepartum hemorrhage? Immediate delivery. Deliver the baby as soon as possible, right? Okay. Next question. This time in 𝗏𝗏CT, they shown this picture like, like holding a lotus flower like this. Holding a lotus flower. So that is related to National Leprosy Eradication Program. This time 𝗏𝗏CT question. So this kind of image-based question they are asking. Right? So which symbol is this? This is related to National Rural Health Mission. National Rural Health Mission. National NRHM. This is NRHM. 𝗲𝗲𝗃. Which stage of labor is presented by the photo? See here. When there is a rupture of membrane. So that is active what? So that is actually what? Like first phase, active phase, right? First phase, active phase. Right now? Only rupture of membrane. But when head is already in the vagina, when you can see the head here, then this is called a what? Second stage of labor. Second stage of labor. After expulsion of placenta, you can say third stage of labor, right? So answer is C. Right? You should know. Right now, you should know, right? Stage 1, stage 2, stage 3. Right? See, easy to, when only rupture, stage 1. When head is into the vagina, you can see the head, you can see the crowning of head, stage number 2. When 100% delivery is done, now stage number 3. This is also 𝗲𝗃𝗃, when you have to do episiotomy. When you have to do what? Episiotomy. Which of the following is not a right method to perform this procedure? Yes, you can do mediolateral, you have to do lateral J shape, but how can you perform anterior-posterior? Basically, especially in a case of primary gravida, to ease the delivery, we have to give a cut. We have to give a cut, especially in the mediolateral position, so that we can make a space, so that there can be easy delivery. If you are not doing episiotomy, if there will be, if there will be a delivery of the baby, right, at that time, so yes, there can be severe rupture inside the vagina. That can lead to postpartum hemorrhage also. So episiotomy is good, supportive, right now. So which is not the right procedure, right method? Anterior-posterior, you are not doing. Next question. 𝗲𝗃𝗃. A pregnant female has undergone ultrasonography. Gestational trophoblastic disease is suspected. What is the most probable diagnosis? As per the snowstorm appearance, where do you see a snowstorm? Where do you see a snowstorm appears? Radiologically based 𝗲𝗃𝗃 question. This is seen in complete high-density form mole. Complete high-density form mole. Sometimes examiner can show you this picture also. So this is actually what? A snowstorm appearance. Snowstorm appearance. Characteristic of what? High-density form mole. Right? Remember it. Next. PSM question. Mala D, Mala N. Which of the following is wrong statement about this contraceptive pill? White color tablets are OCPs. Yes, correct. It is distributed free of cost by the government of India. Yes. 7 iron tablets will be there for sure. Yes. So here, dark colored tablets are folic acid. No, these dark colored tablets, these 7 tablets are what? Iron tablets. So option is B. B. Surgery question. A child is crying a lot during attack and child is going to pull the legs backward. Right now? Means towards the abdomen to get relieved of abdominal pain. Now, when he's passing the stool, that is of what? A small amount of red stool. What is the most probable diagnosis? As per the radiological image, you can see claw sign, red stool, red jelly stone, current jelly, if you remember, dancing sign. Where we have seen all these? Intussusception. 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 Answer is D only. Intussusception. Remember here, see this claw sign you should know. Very repeatedly asked question in intussusception. Okay, intussusception in the surgery question they are asking. Okay. A patient who is suffering from severe pancreatitis presented with ecchymosis around the flank. Which sign? Very easy question. When there will be severe pancreatitis, yes, there can be what? Ecchymotic sign around the umbilicus is called as Cullen sign. Around the flank, Gray Turner sign. Around inguinal fossa, Fox sign. So what is the answer here? Answer is Gray Turner sign, right? Now, Gray Turner sign. Remember here? You can remember around umbilicus Cullens. Gray Turner sign in the flank, GF. Remember like this. Answer is D. This one is the answer. This is around, see, remember this is like around the flank, around the umbilicus, around the inguinal fossa, right now, Fox sign. Next question. A senior surgeon has completed a modified mastectomy. He instructed you to close the surgical area by subcuticle sutures. Subcuticle. Which of the following suture material will you use to close the wound? Here, especially, first of all, breast hai. And you have to do what? Subcuticle suture. No? So that is done with the help of what? Absorbable suture. No, absorbable suture. So out of these four, which one? Catgut. Remember, catgut and 𝗲𝗃𝗃. 𝗲𝗃𝗃. These are what? Absorbable sutures. So under the skin, subcuticular, you can remember subcuticular, right? Remaining on nylon, proline, silk. These are what? Non-absorbable suture. Medicine. What do you see in this photo? What do you see in this photo, first of all? Basically, a radiologically based medicine question. Flower bouquet appearance. Flower bouquet, no? Flower bouquet. Where do we see flower bouquet? Right? Flower bouquet. Where do we see? Medullary sponge kidney, no? Medullary sponge kidney. Medullary sponge kidney. Remember, bouquet of flower appearance. Very, very important. So what will be the symptoms there? Yes, there can be what? Renal stone, hematuria, urinary tract infection. Yes, medullary sponge kidney, right? What is the most common method of taking chest X-ray? I'm sure everyone has gone through X-ray. So, see, X-ray technician will ask you to stand like the backside. So from the backside, the radiation will be coming, no? So most common way of chest X-ray is what? I'm sorry, PA view, right? The most common method of taking X-ray chest is what? PAV, posterior anterior view. This is the most common way. This is the most common method. Right now, in which condition you can do AP view also, anterior posterior view also? Remember here, where person cannot stand, where person cannot, in which condition anterior posterior view of chest will be taken? Where person cannot stand, where person is in coma, or if there will be like if patient is in ICU, simple. Or if you can say flail chest case. What is the definition of flail chest? See, fracture of minimum 2 ribs. Fracture of minimum 2 ribs. Minimum at 2 points. Where there can be paradoxical respiration, right? A paradoxical respiration. So yes, in these conditions, you will do what? Anterior posterior view of chest X-ray. Very easy to understand, right? Please remember, all these points are very, very important. Okay. Next, this is about this, radiological, radiological modality, which is shown here. So this is actually what? Ultrasound. This is based on the principle of what? Piezoelectric effect, right? Remember, see, you would have learned in the general part of radiology, right? Now, piezoelectric effect. Next. This question is related to ENT. A 30-year-old man presented with persistent ear discharge, hearing loss. Modified radical mastoidectomy was done. Patient comes back with persistent ear discharge and a retroorbital pain. You would have learned about a syndrome in ENT? Do you remember? Especially in a disease. What is the term that starts with G? Answer, please. Which syndrome? This is seen in petrositis. This is seen in what? Petrositis. What is the triad here? This is called a Gradinogo syndrome. Gradinogo syndrome. Okay, persistent ear discharge. Involvement of 6th and 5th nerve. Involvement of 6th and 5th nerve. Because of that, retroorbital pain. Right? Remember, this is called a Gradinogo syndrome. Very, very important. This is anesthesia. I think this question was not there in your exam, but you can solve. So this is what? So how much percentage of oxygen is being delivered by this device? First of all, you tell me what is this? This is nasal cannula, right? Your nasal cannula, 44% only. Only 44%. You would have learned in anesthesia. Remember here, nasal cannula, 44%. Oxygen mask and venturi mask, 60. Non-rebreathing mask with reservoir, 95%. Remember, 100% is with rebreathing mask. Sometimes they're asking in anesthesia. This is also related to anesthesia. Mallampatti score, where do we perform? When we do pre-anesthetic check, we have to check that during intubation, will there be any difficulty or not? So first of all, we have to ask the patient to open their mouth, right now. Open their mouth. We have to see the uvula. How much uvula you can see? So Mallampatti score is done before what? Intubation. Remember here, intubation. Remember here, this is class 1, class 2. See here, you can say, see, when I talk about class 3 and class 4, now easily we cannot see the internal part. So there can be more difficulty. Fine. No? So remember here, Mallampatti score, last time FMGE exam also this was being asked. So Mallampatti score we are using before intubation, right? Now before, like we are doing in pre-anesthetic check to check what? The difficulty during intubation. This is also related to ENT. Where do we give incision for tracheostomy? Where do we give incision for tracheostomy? Which ring? Second to third or third to fourth, right? Or second to third or third to fourth. So out of these 4 options, what is the answer here? Second and third, right? See, in between second and third. Tracheostomy. ENT question. This is repeatedly asked question in this, see here, in this audiogram, where exactly at 2000 hertz, you can see a dip. You can see a dip here. You can see a dip. Which notch it is called as? Which notch it is called as? Carhart's notch, right? Where do you see? In which condition? In which ear disorder? Otosclerosis. This is seen in otosclerosis. Remember here, this is called about otosclerosis. There will be a dip at what? 2000 hertz in the bone conduction curve, right? This is called about Carhart's notch. Carhart's notch. Next question. Orthopedics. Remember, in orthopedics, most important will be Colles fracture, reverse Colles Smith fracture. There can be 𝗙𝗪𝗔 fracture. There can be what? There can be, right? So 𝗙𝗪𝗔-Montague fracture. Very, very important. So when you see like you can see the dinner fork deformity here. Dinner fork deformity. Where? Colles fracture. Colles fracture. Right now, Colles fracture. Colles fracture is always an important topic for MCI. Remember here, Montague and 𝗙𝗪𝗔 fracture. Repeatedly asked questions. Sometimes they will show you the X-ray. You have to see where there is the fracture. If there is a fracture over ulnar bone, Montague. If there is a fracture over radial bone, 𝗙𝗪𝗔. Remember like this. See, remember here, fracture of ulnar with dislocation of radial head. Opposite, fracture of radial bone here, you can see what? 𝗙𝗪𝗔. Remember, very, very important. 𝗙𝗪𝗔 fracture and see, Montague fracture and 𝗙𝗪𝗔 fracture. This is also repeatedly asked question in orthopedics whenever there will be what? Hip dislocation, anterior or posterior dislocation. As per the presentation of the leg, as per the rotation of the head, like of the legs, you can understand, right now. So you would have heard about what? Fadir and Febir, right? So this is what here, see, this is what external rotation, no? So this is what is the answer here? Anterior dislocation of hip, right? Anterior dislocation of hip. Remember here, remember the mnemonic fiber: flexion, abduction, external rotation, anterior dislocation. But if posterior dislocation will be there, now see, leg will come inside, see, knee will come inside. So there will be what? Flexion, adduction, and internal rotation in posterior dislocation of hip. This is repeatedly asked question. Next, ophthalmology question. Related to anatomy, can you answer me? Which nerve is supplying the green color muscle here? Green color. Which muscle is this? First of all, lateral part, no? Lateral rectus. SO4, LR6. Do you remember the mnemonic SO4? So say LR6, lateral rectus is supplied by what? 6 abducent nerve. Remember this mnemonic. Superior oblique is supplied by 4th cranial nerve. Lateral rectus is supplied by 6th cranial nerve. Remaining all other are being supplied by 3rd cranial nerve. Very easy to understand, right? So these are what? Extraocular muscles. See, this question is also not, this was not there in the exam, but this is very easy. Optha question you can solve. Munson sign is seen in which of the following condition? Out of these 4. Munson sign, keratoconus, right now? Keratoconus. This is also very favorite topic for MCI people, especially related to trachoma. They are asking about what? Safe strategy, surgical removal, antibiotics, azithromycin, F for facial cleanliness, E for environmental cleanliness, right? Trachoma. See, this is called a what? Munson sign. Munson sign. Okay, there will be what? Protrusion of cornea. Because of that, lower lid will come down like this. This is also ophthalmology question, eye question. Fundus picture of a 65-year-old male patient is showing what? Splashed tomato appearance. Who presented with sudden loss of vision in one eye. He is also a known case of diabetes and hypertension. What is the possible diagnosis? Where do you see a splashed tomato appearance? Where do you see splashed tomato appearance? CRA or VO? Central retinal vein occlusion. Remember, CRVO, very, very important. Remember here, sometimes examiner can give you this kind of photo. Remember, CRAO and CRVO. Very, very important. In CRVO, you can see what? Tomato is splashed. Tomato is splashed. But CRAO, cattle track appearance or cherry red spot. Right now, remember like this. Very, very important. CRAO, CRVO. Repeatedly asked question, right? Okay, fine. This is also optha question. Which of the following is an appropriate treatment option for the given condition? This is what? What are the diagnosis here? If I ask you what are the diagnosis after seeing this picture? Herpes infection, herpetic keratitis. Steroid will be contraindicated. Steroid will be contraindicated, right? So answer is what? Acyclovir treatment. Acyclovir treatment. B. Next question. This is related to pediatrics. By which age a baby will be raising head above the horizontal plane? By which age? In pedia, all milestones are important. Very, very important. Okay. So when a baby is going to, like elevate the head like this, by the age of 3 months, by the age of 3 months. Remember it, like this right now, like this, by the age of 3 months. This is also pediatric congenital heart disease. Can you answer me after looking at this radiological image? Can you answer me? Congenital heart disease, where you can see figure of 8, right? 𝗃𝗵𝐵𝐶, right? 𝗃𝗵𝐵𝐶, right? Very easy to understand. Figure of 8, or you can say what? Snowman sign, right? Total anomalous pulmonary venous connection, 𝗃𝗵𝗵𝐶. See, remember when I show you this X-ray, no, you should revise all. Even you see, where do you see boot-shaped heart? Where you see, I said 𝗃𝗵 boot-shaped heart. So basically all appearances, all shapes on X-ray in case of congenital heart disease, right? That is important. Box-shaped heart, Epstein's anomaly. This is very easy medical question for you. Like this is easy medicine question. I think I've explained you about pickle, 𝗵𝗊𝐶𝗂𝗃𝗃𝗃𝗃𝗃, pickle. When you see icterus, yellow eyes, if you can see, mostly jaundice. So which function, which enzyme test should be performed now? Liver function test, no? Liver function test. Liver function test, no? Jaundice. Medicine question. A child presents with recurrent severe bone pains and hypoxia. Hypoxia. Okay, so there will be lack of hemoglobin. Peripheral smear shows a sickling of RBCs. What else you want? Sickling of RBCs. Management of the disease is mostly done by proper hydration and drug like hydroxyurea. Yes, directly you can answer that. This is a case sickle cell anemia, right? And this is a case of what? Sickle cell anemia. Sickle cell anemia. Next question. Medicine, orthopedics, both. 60-year-old male present with fatigue, weakness, weight loss, and cervical lymphadenopathy. On blood examination, hemoglobin, this much, less. Calcium, very high calcium. Creat, 4.5. And M protein is also seen. M protein in urine. When you see this skull appearance, this is what? Punched out lesion. There is what? Punched out lesion. Punched out lesion. Where do you see? This is seen in multiple myeloma. This is seen in multiple myeloma. Multiple myeloma. See, in multiple myeloma, you would have learned about CRAB, right? No, hypercalcemia, renal abnormality, anemia, and bone pain, right? No, so bone-related disorder. Easy to understand. This is multiple myeloma. This image is more than enough to solve the question. Joint pains, oral ulcer, fever, hair fall, rashes around the face like this. Rashes around the face like this. Suspecting an autoimmune disorder, clinician asked for autoantibodies test. What is the most specific test here? Basically, this is a case of what? SLE, systemic lupus erythematosus, right now. What is the most specific here? Anti-Smith antibody. Examiners will be asking, okay, this is called what? Butterfly rash, malar rashes. So here, when there will be malar rashes, no, which part will be spared? Which part will be spared? Nasolabial fold. Nasolabial fold will be spared. There will be no rashes, right? Remember, very, very important. SLE, every time one question for sure. Remember here, all autoantibodies and all. Malar rash, butterfly rash. Yes, this is psychiatric question. A 19-year-old female wearing jeans and top comes to your clinic. She is complaining of sadness for last 1 month. She does not enjoy in old activities, means what? Anhedonia, negative thoughts. Basically, mostly you can understand this is a case of depression, psychiatric condition. Clinical examination of a psychiatric patient we are doing with the help of what? How we are doing clinical examination to a psychiatric patient? MSE. Mental status examination, where we have to check the behavior of the patient, thought process of the patient, speech of the patient, okay, rate and tone, emotion of the patient, right? Perceptual activity of the patient, right? Cognition of the patient. This is all about mental status examination. Remember, mental status examination is the clinical examination for a psychiatric patient. But you will ask me, what about, sir, option number D? MMSE, mini mental status examination. This especially we are using for organic mental disorder. How much is the maximum score of MMSE? 30. Equal to or less than 24, it will be called as organic mental disorder. Organic mental disorder. So what do we check in MMSE? First of all, we have to check the orientation of the patient. How much oriented he is. After that, I will give him white paper. I will ask him to write 3 words: hat, cap, shoes. That is called as a registration. Then attention and concentration. Then I will ask him what he has written in that notebook or on that paper. Recall, right now. And last, language. These are the 5 components of MMSE exam. 5 components of MMSE exam. Okay. A young boy has suffered a road traffic accident 2 months back. Now he's presented with horrible dreams about the same accident. He doesn't want to go there again. He is having visualization of same accident again and again. Basically, flashback and nightmare, avoidance, insomnia, sleep problem, right now. See, emotion problem. Basically, a flashback and nightmare of the accident. Where do you see? Again and again, PTSD, post-traumatic stress disorder. Post-traumatic stress disorder. A person developed sudden hypertensive episode after taking wine. Family members informed that he was already on any psychiatric medication. Which of the following drug the person must be taking? This was FMGE, last FMGE exam question. See, I hope you remember about MAO inhibitor. Monoamine oxidase inhibitor. Monoamine oxidase inhibitor. Right? This is what antidepressant drug. Antidepressant drug. When a person is already on monoamine oxidase inhibitor, no, he should never be given cheese, red wine, or beer. Why? Because here you are going to see something that is called a tyramine, right? Tyramine. See here, when I talk about tyramine, okay, this is present in red wine, beer, and cheese, okay. So when a person is healthy, when he is taking these things, okay, fine, there will be what? Easy digestion of tyramine. Easy metabolism of tyramine. Because this will be metabolized by monoamine oxidase. Monoamine oxidase in GIT. But when he is already on monoamine oxidase inhibitor, then whenever he is going to take red wine after that, tyramine will not be digested, and this can easily pass, this can come in blood circulation, and this is having sympathomimetic activity, and this can cause severe hypertension, lethal hypertension, which can take the life of a person also. This is called as cheese reaction. Cheese reaction. How to treat? Phentolamine. You have how to treat phentolamine. Forensic question. A case of RTA brought for autopsy. On postmortem examination, a particular group of muscles were stiff and rigid with no state of primary relaxation. Remember, whenever there will be rigor mortis, no, first of all, there should be primary relaxation, then a rigor mortis, then there should be what? Secondary relaxation. This is the normal rule of rigor mortis, but there is a condition which mimics like rigor mortis, where only a group of muscles which were at a strenuous activity, maximum activity just before the death, sudden goes into spasm, and it continues even after death. So what has happened here? Without going into primary relaxation, that group of muscles went into rigidity. This is called as cadaveric spasm. Cadaveric spasm, which is antemortem in nature. And only voluntary group of muscles are involved. This is antemortem, right? Cadaveric spasm. Police has found a dead body with a disfigured face. For identification, police is asking the family members to provide old photos of deceased. This is a technique applied to determine whether the skull is that of the person in the photo or not. Basically, a skull and photo will be superimposed. If this will be same, okay, dead body is the same, right? No? So this is a method of identification. This is called as superimposition technique. Okay, old photo and skull pattern will be matched, right? Now, superimposition technique. Remember here, when I talk about dactylography is what? Fingerprinting. Dactylography is what? Fingerprinting. Where was the first center established in the worldwide? Worldwide, India. India mein kaha? Kolkata. Remember Kolkata. Okay. Fingerprinting. How many fingerprintings are there? 4. Remember here, claw, composite, loops, arch, and holes. Most common type, loops. See, remember here, dactylography, fingerprinting. This is the most reliable method of identification. This is most reliable method of identification. Even identical twins will be having different fingerprinting. Question is that when you will apply MCI form, when you will write, and when you will apply MCI form, you have to give thumbprint. When you will be in examination hall, there also you have to give the fingerprinting. How they are going to match? How many lines should be compared? How many lines should be matched? Minimum 10 to 12 lines. Minimum 10 to 12 matching. Okay. Ideally, fingerprinting will be same throughout their life. In which condition fingerprinting can be altered? Remember, pneumonic right leg, radiation injury, leprosy, E for electric injury, G for skin grafting. Please remember, in these conditions, yes, fingerprinting can be altered. Fingerprinting can be altered. I hope this is clear to all of you. After the murder, a young criminal is brought to hospital for age estimation. What is the most probable age as per the given X-ray? See here, suppose if there is a young murderer who appears to be in between 17 to 18-year-old. His advocate is fighting that, no, he's a juvenile only, he's not adult. Why he's claiming like that? So that there should be less punishment, no? Less punishment. So what is the first investigation to be done? X-ray of wrist. X-ray of wrist, most important. Because even if you take the X-ray of elbow, remember here, ossification of elbow will be completed by the age of 16 years. But you cannot say, yeah, 16 years, then 100%. You can say, okay, juvenile might be. But now wrist X-ray is most important. You have to look at the ossification. Bone formation is completed or not. Look at ulnar. If it is completed, age must be 17 to 18. Now still confusion, he is adult or not. Now look at a radial part here, radial. Okay. Look at a radial part now. See, remember here, this ossification will be completed only after 18. Will be completed by 18 to 19. If this ossification is completed, no, it means what? 100% he is adult. So as per this X-ray, what is the age here? Minimum 18. He is more than 18 now. Very easy to understand, right? So in this manner, we can identify if a person is adult or not, right? You have learned in forensic science. Now, this is also forensic. If you do the virginity exam here, right? Labia majora separated, labia minora flabby. Vagina is roomy, but hymen is intact. Hymen is intact. As per their case, you can understand that this female, she had the experience of sexual intercourse with intact hymen. So this is a case of what? False virgin. False virgin. Next question. A female patient of bipolar disorder is on lithium for last 1 year. Which of the following side effect is least likely to occur? See, remember here, I have taught you lithium toxicity. That is very, very important. You should know lithium toxicity. Remember, when I talk about option number C here, no, option number C. This is one of the extrapyramidal symptoms. This is one of the extrapyramidal side effects. that is seen after antipsychotic drugs like haloperidol? So answer is C. So what are the lithium toxicity? Remember here, lithium can affect so many parts of the body. It can affect CNS, so it will cause what? Coarse tremors. See what side effect it is going to cause in endocrine part. This will be affecting what? TSH hormone. So it causes what? Hypothyroidism. GIT, nausea, vomiting. Renal, this will cause polyuria. After that, polydipsia. And finally, this will cause what? Nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus. Remember it. See, lithium can cause nephrogenic diabetes insipidus. Why we are learning all this? Because remember here, lithium, overall, lithium is a gold standard mood stabilizer. But lithium has very narrow therapeutic index. Because of this, it has so many side effects. So many side effects. How much is the half-life of lithium? 1.3 days. Since it is a notorious drug, we have to do therapeutic drug monitoring. We have to do therapeutic drug monitoring. Plasma concentration, we should check. Okay, fine. Excuse me. See, okay. So we have to do what? Therapeutic drug monitoring. We have to do this, right? Or we have to do therapeutic drug monitoring, right? Very easy to understand. Question is that lithium will achieve its plasma concentration only after 5 to 7 days. So first blood sample for TDM, we have to take only after 5 days. Only after 5 days for plasma concentration, right? Okay. And after 12 hours of last dose. 12 hours of last dose. Remember here? So that's why lithium plasma monitoring is very, very important. Remember here, every time, whenever you are going to start a patient on lithium, always remember that it should not be more than 1.5, because more than 1.5 plasma concentration is indication of toxicity. Extreme condition, patient can die. Last option is a dialysis only. Last option is a dialysis only. Okay. So remember here, side effects like it can cause a diabetes insipidus also, right? Okay. Remember, for diabetes insipidus, you are giving thiazide diuretics. Patient who is already on lithium. You can also give spironolactone. One time in MCI, they have asked what is the relation between thiazide and lithium? Relation between thiazide and lithium. Remember, thiazide decreases lithium excretion. Thiazide decreases lithium excretion. So please write down, thiazide will increase the lithium toxicity. It will cause a lithium toxicity. Okay. Skin, side effect of skin, rashes, folliculitis. What is the teratogenic effect of lithium? During the first trimester of pregnancy, if you give lithium, yes, there is very high risk of abstinence anomaly. There is very high risk of abstinence anomaly. High risk of abstinence anomaly, right? No, heart defect. So these are the side effects of lithium. So remember here, hypothyroidism, this one, diabetes insipidus, all these are the side effects of lithium. But tardive dyskinesis, right now, this is the side effect of haloperidol, or first generation antipsychotic drug. Lithium is a mood stabilizer. ENT question, where do you see Trotter's triad? Nasopharyngeal carcinoma. Nasopharyngeal carcinoma. NPC. Nasopharyngeal carcinoma. Neuralgia, palatal palsy, conductive hearing loss. Remember here? See here, one-liner question they have asked sometime before. Okay, Trotter's triad or what? Sinus of Morgagni syndrome. Next, forensic. A body decomposes in air 2 times as in water and 8 times as in earth. Basically, ratio is of 1:2:8, air, water, and earth. Where we have learned rate of decomposition, compos mentis or what? Now, this is called rate of decomposition is what? 𝗏𝗄's dictum. 𝗏𝗄's dictum. See here, all four words are similar, no? So you can have confusion. Compos mentis means what? Before giving dying declaration, doctor has to certify that the deceased person, the dying person, the statement, whatever he has given, at that time he was completely oriented and conscious. पूरे होशो हवास में बयान दिया है. That is compos mentis. Corpus delicti. It is called as essence of crime. Right? Next question. Patho. A 42-year-old patient present with symptoms of premature aging, diagnosed by Werner syndrome. What is the most likely mechanism here? Werner syndrome, premature aging, short telomere, right? A short telomere, right? With the damaged DNA part, right? Next. This is also very easy. A 10-year-old boy complains of fatigue, abdominal pain after playing football. He also complains of painful swelling of digits. Small spleen is also seen. Small spleen because of sickling of RBC, which can stick to a spleen. After that, it can cause a scar. And see a scar, so there can be what? Fibrosis, right? So there can be a small spleen. There can be autosplenectomy. Where? All these signs and symptoms, where? Sickle cell anemia. Sickle cell anemia. A 20-year-old patient presented with history of malabsorption, diarrhea, poor appetite. Duodenal biopsy of patient shows crypt hyperplasia, villus atrophy, and CD8 plus cells in lamina propria. See if you can see malabsorption, crypt hyperplasia, villus atrophy, and all. Yes, all these we see where? In celiac disease. We see where? In celiac disease. Celiac disease, right? Next, which of the following factors play a major role in initiation of thrombus formation? You would have learned about Virchow's triad, SHE. Stasis, hypercoagulability, and endothelial injury. All these are helping where? In thrombus formation, blood clotting, right? Endothelial injury. This is called as what? Virchow's triad. This is called a what? Virchow's triad, right? Now, Virchow's triad. Next, very easy question for you. Both hyperplasia and hypertrophy, where do we see? Together. Pregnant uterus, right? Pregnant uterus. Next. Which type of hypersensitivity reaction we see in myasthenia gravis? Myasthenia gravis. Type 2 and type 5 you would have learned in pathology right now. So type 2 hypersensitivity reaction. These are direct questions, right? Now, so remember type 1, type 2, type 3, type, all examples you have to memorize, okay? This is also one-liner question of pathology. B cells are induced to produce immunoglobulin E by which of the following interleukins? Bolo. Interleukin 4. General pathology, minimum 10 to 12 questions will be there. Overall pathology and medicine. Patho, remember here, patho plus medicine. In total, 50 questions easily. 50 questions. Only these two subjects. This is also one-liner question. Where do we see effacement of foot processes on microscopy? Where do we see? Minimal change disease. All these, see here, no. Last few questions are very easy. Direct one-liner question of pathology right now. So minimal change disease, we see what? Foot processes. This is also a very easy question of, like CVS pathology or medicine. You can say, where do you see large, friable, irregular vegetation on the cardiac walls? Where do you see? Where do you see? Infective endocarditis. Infective endocarditis. All these four options related disease. These are 4 diseases. Please go through all. You have to go through all the points related to these 4 pathologies. Very, very important. A child present with hyperuricemia, delayed developmental milestones, habit of biting fingers. Remember here, self-mutilation in a child with mental retardation, where you see 𝗏𝗏 syndrome. 𝗏𝗏 syndrome. Deficiency of which enzyme? 𝗏GPRTase enzyme. See, there will be problem in purine metabolism or pyrimidine. Purine metabolism. Okay, purine metabolism. 𝗏𝗏 syndrome due to deficiency of 𝗏GPRTase enzyme. See this question. This looks like a big question, but you should read and solve. Please answer this question. See, this is about COVID-19 patient. See, if you see the examination here, ABG report pH, CO2, oxygen, potassium is normal, but sodium is how much? How much is the normal level of sodium? How much is the normal level of sodium? 135 to 145. How much is the normal level of potassium? 3.5 to 5.5. 3.5 to 5.5. Okay. So as per this situation, we can understand that yes, there is what hyponatremia case. Hyponatremia case, right now. So see, remember here. So how will you understand what are the symptoms of hyponatremia? Sodium is related to brain. Person can be what? Irritated, agitated. Person can have what? Mental confusion. Mental confusion, right? So this is a case of what? Hyponatremia. Potassium is related to heart. There can be what? Hyperkalemia or hypo. There will be imbalance. There can be arrhythmia, right? No, imbalance in heart rate. Now the question is that whenever you have a patient of hyponatremia, this is important. Hyponatremia, how to treat the case? Always remember that you have to replace sodium, no? You have to replace sodium. So you have to give what? Slow infusion of hypertonic saline, not the normal saline. Hypertonic saline like 1.5% or 3% sodium chloride. Hypertonic. But you have to give slow infusion. Slow infusion. Why slow infusion? Suppose if you have given instruction to the nurse that Sister Ji, I'm going to see other patient. Please do slow infusion of hypertonic saline. Okay, but nurse was not serious. What she did? She did fast infusion. Fast infusion can cause what? Fast infusion can be very, very serious for the patient. Very, very serious for the patient. Fast infusion. Remember it? Because it can cause what? Suddenly you are going to increase the tone, no? Right? So this can cause what? Osmotic demyelinating syndrome. Osmotic demyelinating syndrome, or you can say what? Central pontine myelinosis. Remember it? This can take the life of the patient also. So remember here, fast infusion of hypertonic saline should never be done. Right now, slow infusion. Easy to understand? Fine. Next question. Forensic perianal region. An examination of sample taken with the nitric acid from his perianal showed yellow needle-shaped crystals of spermine picrate. Which test is performed? I have taught you in forensic. Remember your FB, Florence test, brown color. BY, Barberio's test, yellow needle crystal. Barberio's test. Remember, this is Barberio's. Yellow color, Barberio's. Brown color, Florence test. Very, very important. Answer is C here. Okay, fine. Last question. A fertilized ovum reaches the uterus at which day? Fertilized of menstrual cycle, it is being asked, no? Menstrual cycle, right? Fertilized ovum. After complete fertilization, no? By the age of 20th day. C. Answer is C. Right? 6th day of fertilization and 20th day of menstrual cycle. Fine. So in this manner, we have solved, we have done good discussion of 150 questions. 150 questions. See here, overall purpose of taking this exam was your self-assessment. Please check where you have done mistakes. I have asked you 150 questions from 19 subjects. We have done the discussion of 19 subjects. Many a times, in many questions, you would have done mistake for sure. Okay, now analyze yourself. Where did you do the mistake? Why did you do the mistake? Okay, and now you plan your, like a strategy accordingly, because still you are having more than 2 months, right? Or more than 2 months. Remember here, suppose if you have scored more than 120, suppose if you have scored more than 130, extraordinary. More than 130, more than 140, you are extraordinary. Okay. See here, if you have scored more than 120, I would suspect in examination, in final examination, your score will be around 220. If you have scored more than 110, your score will be around 200. Around 200. Suppose if you have scored 100 to 110, your level is 190 to 200. 190 to 200. Suppose if you have scored more than 90, means 90 to 100. So in final exam, your score will be around 175. If you have scored more than 80, means 80 to 90, your score will be around 160. Minimum 75, okay, then 50%, fine. See, I'm telling you one thing. Even if you have scored only 60, even if you have scored only 60 now, your range means now your preparation is that you can score approximately 130 marks out of 300. This is also not bad. Now, this is your level that you can score 130, but still you have 2 months now. In 2 months, you cannot increase. You cannot increase the score by more 20 marks. Huh? Even if you are, see, even if you have scored 60 or 55, 60, I would say 60, it means what? Now your level is 130. 2 months are more than enough to touch 155. 2 months you have enough. You can improve in next 2 months. Next 2 months for 20 marks. Yes, you can. 100% you can. Fine. So yes, so I'm sure after this discussion, now you will be having a kind of self-confidence, right? A kind of self-assessment, and you have understood about your, you have understood about your level of preparation. And please start. So I'll start doing revision in the same manner. And see here. So test and discussion, rapid revision, all these are important. Fine. Now your target should be still. Just a minute. Remember here. Focus on major 8 subjects. So remember here, focus mostly on 8 subjects: surgery, medicine, obs gynae, PSM, patho, ENT, ophtha, pediatrics, medicine. These 8 subjects, please revise minimum for 3 times. These 8 subjects, I'm saying, revise minimum for 3 times. After that, short subjects: psychiatry, radio, ortho, anesthesia, forensic, and skin. In this manner, you can improve. You can score more and more. After that, micro, pharma, anat, biochem, physio, all these are your bonus. Suppose if you are able to revise, please revise. Please revise. You can increase the score. Okay, fine. So on 16th again, on 16th November, there will be mock exam, Pan India mock exam, 300 questions will be there, 300. Please write the mock exam. 6 to 8 mock exams, please write. Okay, this will help you in understanding. Now, when you are writing the exam, make a stamina to sit for 300 questions, 5 hours. This will help you. Okay, so I'm sure like this will help you. So chalo then, I wish you all the best. And now I think this is enough of a study now. Okay, all right. So this is Diwali day today. Now close your books, close your books now. Okay, go and get ready, celebrate, enjoy. So I wish you and your family a very happy Diwali. Thank you so much. Bye-bye. Thank you so much. Bye-bye.